To any members and staff who are joining today, please stay on mute until the meeting begins. We will be testing our live stream and you will be live streamed on YouTube. Thank you.
taking the video off
Thank you.
because your head's in the screen.
Well, I'm trying to help you out here because this is.
But how did you do volume before?
Reminder to members of committee, commission and council and staff that are on the line. We are now going to be broadcasting live to YouTube. Thank you. Please stay on mute until the meeting begins.
Morning, everyone. It's Vera, just checking out my audio. Thumbs up. Great. Thank you. Merci.
Morning, everyone. It's Jan.
Hi, Jan. Thanks for joining us.
Morning, everyone. Jean Cloutier here.
Okay, we'll get started in about 30 seconds, folks, if that's okay with everybody.
You do have quorum, Mr. Chair.
Thank you, Chris. I got to do the roll call first, too, so. Okay. Good morning, everyone, and welcome to today's special meeting of the Transit Commission for the 1st of June, 2020. If you don't mind, we'll do a quick roll call here. Councillor Suds,
Here, good morning.
Councillor Gower,
Here.
Councillor Kavanaugh,
Present.
Councillor Tierney,
Present.
Councillor McKenney. Councillor McKenney, I don't see her on my screen. Okay, not here. Councillor Brockington
Here.
and Commissioner Caricato. Commissioner Caricato. Commissioner Olson.
Present.
Thank you. Commissioner Williams
Here.
and Commissioner Wright Gilbert.
Good morning, here.
And finally, Vice Chair Cluche. You're here.
Present. Thank you, Chair.
Okay, great. Thank you. Welcome, everybody. Before we get started, I'd like to offer a few remarks. Before we go further, I'd like to say the following. During the pandemic, there was a few who questioned why the commission meetings were canceled. The Transit Commission, along with every other City of Ottawa committee, respected the provincial emergency response order in response to the pandemic. The city clerk advised all committee chairs that unless there was a statutory requirement or a time-sensitive report, which happened to only apply to planning during this pandemic, we should not be holding meetings. The clerk, on behalf of the city, only recently added the option like today to use Zoom and other technologies to enable public participation in a committee meeting. Council has to date only been limited to conference calls for our meetings. Our ridership were able to keep in contact directly with OC Transpo and any of us by means of email or phone, so their concerns continued to be heard and addressed throughout the pandemic. I want to close my remarks by taking the opportunity to thank all the riders for their support and every employee of OC Transpo for their part in keeping our transit system moving 7 days a week, even during a worldwide pandemic. For your efforts, you have my sincere appreciation. Okay, now before we go into the agenda, I believe Commissioner Olson would like to make a statement as well.
Thank you, Chair. I had intended to make these remarks much earlier in the year. That was not possible, of course, as the Chairman has alluded. At the Transit Commission meeting of December 2019, I made remarks that were seen by many as attacking one of the members of the Commission, Commissioner Wright Gilbert. This was not my intention. I'm sincerely sorry for the hurt my remarks may have caused Commissioner Wright Gilbert, others on the Commission, or any in the wider public. It is also possible that Commissioner Wright Gilbert was intimidated by my actions at the meeting when I tried to show her on a laptop computer the basis for my remarks. For this as well, I'm truly sorry. In the spirit of reconciliation, I offer sincere apologies to Commissioner Wright Gilbert and to anyone else I may have offended.
Thank you, Commissioner Olson. So as noted when the agenda was distributed, we are participating in this meeting electronically via Zoom. Instructions for members of the public wishing to submit comments or participate as a delegation in this meeting were included in the agenda. Those who do not need to participate in the meeting can also watch the live stream on the city's YouTube channel. For those who are participating in the meeting, please keep your microphones muted until I call on you to speak. I will provide each commission member with the opportunity to ask questions or comment in due course. Commission members will be called on first in ward order, followed by any other members of council who have joined the meeting. At any point, if you want to speak, you should use the raise hand Zoom function, which you will find by opening the attendees list using the Zoom controls at the bottom of your Zoom window near the audio controls. The committee coordinator and I will be watching for those cues. The usual 5-minute speaking limit will apply. And this morning, you'll be hearing from Dr. Vera Etches, Ottawa Chief Medical Officer of Health, and also from Councillor Keith Egli, Chair of the Board of Health. And of course, from our own Mr. Manconi, the General Manager of Transportation Services Department, and his staff on the OC Transport Transit Service Recovery Plan in dealing with COVID-19. As this is a special meeting to consider the OC Transport Transit Service Recovery Plan, there are no other items on today's agenda. So before we move on, is there any declarations of interest? Seeing none. Okay, and I see Councillor McKenney has joined us. Okay, Mr. Manconi, would you like to start?
Thank you, Mr. Chair, and good morning, everyone. Mr. Chair, my management team is on this Zoom call, but in addition to the personnel that you know, we have a new member that I'd like to introduce, and it's Brandon Richards. He is our new Chief Safety Officer that we've recruited. He has extensive rail background and safety background, so I want to welcome Brandon to our team and to his first Transit Commission meeting. Mr. Chair, I also want to take a moment before we get into the report to thank our staff that have worked through this pandemic. Every woman and man at OC Transpo has worked tirelessly around the clock to keep our transit service moving. They've put themselves at harm's way because they care about this community and they care about the mobility of people throughout our city. And they are joined up with us together to get us into this recovery phase and through the recovery phase. Very historic moment in transit. And I want to thank all of the personnel of OC Transpo and the 3 union leaders who have been outstanding to work with. Mr. Chair, just a few comments about the plan. The plan that's before you for your consideration today has one goal in mind, and that is the safety of our customers, staff, and the community. And as it relates to our very, very important role in keeping people mobile and in the recovery phase of our community, applying all lenses to it. The plan was developed with Ottawa Public Health, and I want to thank them. Dr. Etches, Brent, who's with us today, and their team have been great to work with, not just on this plan, but on navigating through the pandemic. Every single day we're in contact with them. We've applied hundreds and hundreds of hours of research, best practices. We're on the North American panel for recovery and also in the Canadian panel. And we're looking, we've been looking overseas for ideas and suggestions for areas that are ahead of us in terms of the curve and the recovery of transit. So best practices from around the world have been applied. We've worked with our union partners, the Office of Emergency Management, Ministry of Transportation for the retrofits that you're going to see to our vehicles. And everything that's before you today is in accordance with provincial and federal guidelines and mandates. The plan is about implementing numerous measures to keep our customers, staff, and the community safer. The recommendation for mandatory masks is, as you're going to hear from Pat, is required as social distancing is no longer feasible as ridership increases. So we're going to have some dialogue on that and explain that to you in Pat's presentation. And that decision was not taken lightly. The use of the mask is about all of us doing our part to protect each other as we work our way through this difficult recovery period. By applying the equity inclusion lens, you will hear that we have some very innovative approaches to ensuring that everyone in our community has access to masks. Before I turn it over to Dr. Etches, who I again want to thank both her and Chair Egli for their support, I want to touch on a few points. First, the reaction to this plan since its release on Friday was very positive, from the transit professionals in Ontario to members of the community, and some very good questions have been raised, and we hope to answer all those questions for you today. The question of enforcement of masks obviously is the first one that immediately comes up. And the plan that you're going to hear is about everyone doing their part, as I've said. And it's not about enforcement, it's about education. We have a very extensive and detailed education campaign that we're going to show you today. And it's going to be launched immediately after your approval, if you approve it, with a specific messaging towards masks. And the elements associated with that campaign on masks will be based on a number of principles. Firstly, we're going to be explaining respectfully why masks are needed. Secondly, we're going to acknowledge that there will be exceptions. Thirdly, the equity inclusion lens has been applied, and we're going to show you how that works with masks and with all elements of the plan. By applying that equity inclusion lens, we're going to ensure that everyone has access to masks, and all OC Transpo staff are going to be trained on how the program works, how to work with our customers, and how to identify the exceptions. Mr. Chair, the program is about, as we like to say at OC Transpo, community on the bus and the rail system. It's all of us taking care of each other, our customers, and our employees. I'm now going to turn it over to Chair Eglai. He'll then be followed by Dr. Etches, and then we're going to roll into the presentation with Pat. So the next three speakers are going to roll through. Thank you, Mr. Chair and members of the Commission.
Thank you, Mr. Manconi, and thank you, OC, for reaching out to OPH, and thanks to the OPH team for working with OC to come up with some really innovative and cooperative solutions. Transit is essential to the reopening of our city, but we have to do it smartly, and we have to do it as safely as possible. A lot of questions have come up, as Mr. Manconi just indicated, especially around masks. There's a wealth of information on the OPH website about masks, including the proper wearing and carrying of them, where to purchase them, and there are many, many options in this regard. There are approximately 70 vendors listed on the website. While most are online, many also offer the ability to purchase over the phone, offer delivery by mail, or curbside pickup. So there are lots of options out there in order to get a mask. We would love to see buy-in for the masks. As Mr. Manconi indicated, this is not about enforcement, it's about education. It's about working together as a community. I believe we're going to get there. We have seen over the last number of months incredible buy-in by the citizens of Ottawa to smart social and physical distancing. The residents of Ottawa get it, that to protect one another, they have to or should follow the rules and guidelines set forth by public health and by the other levels of government. And we've seen that repeatedly. We've seen people stay 2 meters apart. We've seen people already wear masks when that's not possible in grocery stores, drugstores, and in a variety of different ways. We have a 2-week break-in period with plenty of time for people to be educated, get used to the idea of wearing masks, and to order or buy masks as necessary. But we can't lose sight of the fact that wearing masks protects those around you. And as more of us start to use the transit system again, and as I said at the beginning, that is going to be essential to the reopening of the city, it's going to become more and more difficult to achieve that 2-meter physical distancing that all the public health agencies recommend. However, if you are wearing a mask, that protects your fellow passengers. And if you doing that convinces your fellow passengers to also wear a mask, they're protecting you. In other words, wearing a mask is a win-win scenario for the city, and it allows us all to continue to fight back against this virus. And at the end of the day, that is our common goal. That is the common good that we all share. So I invite you to listen carefully to what Dr. Etches has to say and the balance of the presentations, because there's a lot of good information we're going to get this morning. And public health will be there to support OC Transpo and its passengers going forward as we enter this new phase. Thank you very much.
Thank you, Councillor Eglai. Dr. Etches, please.
Yes, so I think a point that hasn't been made yet, but it's related to my role as the medical officer of health, is that the health of people in our city is determined first and foremost by whether they have enough income and whether they can get to work and have work. So my interest in supporting the return to public transit, and this plan is about making sure people have the ability to get to work, and other important activities. Supporting one another, caring for family members and friends. All of this requires public transport for many people in our city. Uh, so I just wanted to put that out. That's the goal first and foremost. It's about health, as people need to access things for health. And so there are ways to reduce risk of the COVID transmission, which currently does still exist. The people in Ottawa have done a great job being able to flatten the curve with the physical distancing that we've done. But we do see a very, very slow decrease now in the hospitalizations in our community, which show us that there's still virus out there. We can't always pinpoint exactly where it is. We're working to contain it. We'd love to eliminate it, but we're not there yet. And so it does still require us to do the physical distancing. And there are other measures that make sense, right? Staying home when you're sick, making sure that we wash our hands, keep our hands clean. But when we can't be 2 meters apart from others, I've been recommending for over 6 weeks that we need to wear a mask to protect others. It's an added layer of protection. We've learned this from other countries as the pandemic has evolved. We've seen success in countries where this is part of their strategy. And we have seen that this is something that the population is willing to do in exchange for having the ability to access services. And right now we're in a period where we need to monitor. We have a dashboard at Ottawa Public Health that's published daily on our website that is showing us metrics related to the virus in our community, how our health system is doing, our public health capacity, and how our testing is going. These are the measures that we need to watch for a number of weeks still until we can assess what's this impact of us all getting back to more activity. People are getting back to more activity, and we will start to see that on the transit system. It will become harder to physically distance. So that's why, upon reviewing, the plan put forward by OC Transpo, we're happy to support the approach for mandatory masks. This is something that I haven't made mandatory across the whole city because people, for the most part, are doing the right thing. They are protecting each other. This is just a particular environment where sometimes people have no choice to enter into that environment, and they should have as much protection as possible. It isn't forever, and we do know that we need to support people who may not have a mask. And so that's also why I appreciate the approach being taken, is that there is recognition that some people will need assistance to be able to have a mask to wear, and not everyone can wear a mask. This is reasonable, to take a reasonable approach. The more we can all wear masks, the better, but it won't be 100%, and we can still get protection from that approach. So I want to indicate that Ottawa Public Health will be continuing to use our dashboard, our monitoring of the situation, to inform the public about why masks are still recommended and to update people if that changes. Happy to support this, and also indicate that there may be more questions in more detail. And Dr. Brent Malachny is an Associate Medical Officer of Health with Ottawa Public Health. He is available. He'll be able to stay longer to answer those questions.
Thank you, Dr. Etches. I think it'll be very helpful for all the members if we now go to the agenda item and the presentation before we go to questions. So I appreciate your participation today and all your guidance to help staff to prepare the report. Very much appreciate it. Okay, if we can move on to item number 1, which is the OC Transport Transit Service Recovery Plan for COVID-19. Mr. Scringer, I believe you have a presentation for everybody.
I do. I'll just wait for the clerk's department to put it up on the screen.
Maybe while we're waiting for it to come up, I'll finish reading out what's in the report for it. So what we're going to be asked to do, members, after this presentation, and we'll go to delegations, and then we'll go to questions of staff. But in the end, you're going to be asked to do two things. One, approve the OC Transport Transit Service Recovery Plan as outlined in the report. And two, that the wearing of non-medical cloth masks or equivalent face coverings be a mandatory requirement for any person entering OC Transport bus, train, or station effective June 15, 2020, and continuing until widespread mass use is no longer required in the opinion of the medical officer of health, and that this requirement be implemented by the General Manager of Transportation Services as further described in the report. Okay, is the clerk's office ready? Chris, are you ready with the presentation? There we go.
Thank you, Mr. Chair. Thank you, Chris and Caitlin. I'll just turn to the next page, please. So the plan, the recovery plan that we're going to speak to about today has these key elements: keeping everyone as safe as possible. That applies to customers and to OC Transport staff. And I'll take you through our recommended return to full service with the summer service, the fall service, what we will do with the school services, and looking forward into next year. Next slide, please. As you've heard from all the previous speakers, there are prerequisites before ridership returns. These are things we have to get ready for on the transit system before people come back in great number to use the transit system. We need to increase the amount of space on board. We do that by returning to normal service levels system-wide, by putting all routes back in operation, by extending the ability for all customers to use the entire vehicle and thus to return to front door boarding on buses. And in order to be able to do these things, we have to be able to put in protective equipment to replace the physical distancing, barrier shields in some cases to protect our staff, and compulsory masks for everyone when physical distancing is no longer possible. Next slide, please. The objectives of the recovery plan, and you've heard some of them already, it's to provide transportation for everyone between all parts of the city to support the economic recovery of the city. We've integrated this into the city's roadmap for the recovery phase from the pandemic. We continue and we will continue to provide transportation for essential workers and to essential services. We need to accommodate increasing ridership as workplaces, businesses, schools, and other destinations reopen. And we need to continue to keep customers and staff as safe as we can. Next slide, please. So the principles guiding this recovery plan include that it is a rolling wave plan that will be adapted continuously as conditions evolve. What I'm telling you about today and what is in the report you read is the snapshot of where we were last week based on many weeks of work up to that point. But things will change and we have to adapt the plan as things change. The plan is developed based on industry associations' best practices from all across the world and research from all across the world. We will be guided by federal and provincial guidelines, plans, policies. The Medical Officer of Health, as you know, has reviewed and supports the plan. We've applied the city's equity and inclusion lens. But it's very important to note that if a second wave of COVID-19 comes to Ottawa, there could be a need to change this plan to step back to physical distancing restrictions, reducing service. We will have to adapt to whatever comes. And we're also, of course, consistent with the transit bylaw of the city, which provides a framework to address a range of matters, including respecting the health, safety, and well-being of customers, and how to take actions during an emergency situation, as we're in right now. Next slide, please. So the city's roadmap to recovery, as the city manager briefed council on earlier, follows the province's three-phase framework. The province has the three phases of protect, restart, and recover. And the city's roadmap is being led under five task teams: the human needs group, the services group, the people group, the finance group, and the economic recovery group. Next slide, please. I want to say a few words about what public transportation is and is doing in this pandemic. All across the world, transit remains an integral part of all cities. It's needed for transportation into dense areas like downtowns and other busy areas. It's needed for travel by people without other means of travel. It's needed for sustained economic activity and growth of every city, and it's used by many, many other people in normal conditions every day. Across the world, transit has been adapting to public health directives. Physical distancing on board has been possible while ridership has been very low. Enhanced cleaning has been applied universally on transit systems and on other public transportation services. All aspects of the service are reviewed all across the world to reduce touch points and points where people might come into contact with each other. And measures to keep customers and staff as safe as possible when ridership increases are what transit systems all across the world have been doing to be ready for the time when people go back to work, go back to school, and go back to other activities. Next slide, please. Physical distancing has been possible on our transit system, and as I said, on transit systems all around the world because ridership has been very, very low. Ridership has been at about 15%, rising more recently to 20% of usual levels. We reduced our service here in Ottawa to about 60% of the usual levels. That results in about 4 times more space for each customer than there would normally be. We've asked customers to board buses through the rear door, all except those who need the accessibility features of the front door, and that has enhanced safety for our staff as they've been isolated from the bus operator. But this leaves space on the buses available only as ridership gets up to about 40% of regular levels, and on the trains up to about 20% of regular levels. If we go beyond that, when ridership becomes higher than that, it requires the most space that we can give, and it will require other protective measures because the physical distancing will no longer be possible. Next slide, please. So as I've said, higher ridership requires other measures to keep people as safe as possible. When we return our bus service to the usual levels from their current 60%, that will allow more space on buses and on trains. If we have regular service levels in place and we were to try to maintain physical distancing, the buses would have space to accommodate about 40% of the usual ridership. That's about twice where we are right now, 3 times where we were when the presentation was started, and maintain physical distancing. On trains on line 1, we would have space to accommodate about 20% of our usual ridership. That's about 33% above where we are right now. That's the most we could accommodate on our buses and our trains if we were to require the full physical distancing that's been in place for the last 2 months. Next slide, please. But that's not feasible. We would need, if we were to get back to full ridership and we were to try to maintain that same physical distancing, we would need 4 to 6 times as many trains as we have. We would need 2 to 3 times as many buses as we have. And that's not feasible. It's not possible to acquire that many buses. It's not possible to maintain, store with our current facilities that many buses and trains. It's certainly not possible for the city to afford that much additional capacity. And it would be very, very challenging. It would take a long time to staff that much service. So therefore, there must be other means in place. And this is what leads us to the mandatory masks. There must be other means in place to assure safety. Next slide, please. There's been a lot of research done by a lot of people, and one of the best that has led a lot of us and that is easy for us to understand and communicate is this concept that there's a hierarchy of controls. And this comes from research that was been done in the US. It comes most directly to us from Johns Hopkins University in Baltimore. And it talks about the most you can do and then what you later have to do further down the pyramid as you get more and more focused. Physical distancing is the easiest. Having people work from home, do their shopping or other businesses from home. Physical distancing is more than just while you're traveling or while you're out on the street. It is what we've been living for so long. Then we go down into the second level, the green level, where you can do engineering controls, creating barriers between people, as we have done, reconfiguring space, such as requiring people to get on through the second door of the train, the rear door of the bus. Administrative controls, as I've described and as I will describe, we're continuing to find ways to reduce contact between individuals using technology where it's available to us. And then the final thing is the personal protective equipment. Having people wear non-medical cloth masks is the step you go to when you have to on this chart. The next slide, please. So as I mentioned earlier, the province has adopted a 3-stage approach for reopening, and their stage 1, they're opening selected workplaces that can meet the current public health guidelines. They've allowed essential gatherings of a limited number of people, and they've reopened some outdoor spaces. And this is the stage we're in now. We're looking forward to stage 2, when they'll be able to open more workplaces, when those workplaces have significant mitigation plans, opening more public spaces and allowing more public gatherings. And then stage 3 will be the point at which we can return to what we used to consider normal, when all workplaces can be opened, but everyone will have to be responsible and relaxing those restrictions on public gatherings. Next slide, please. Now, all through this, we need to continue to protect, and there will be continued protection for vulnerable people. That applies through all 3 stages. And as I've said earlier, and as Mr. Manconi said earlier, public agencies all across the world, including transit systems, are adopting a similar multi-stage approach. The next slide, please. So the background recaps some of what I've said earlier. The province has adopted the three-stage approach for reopening the economy. The city has been planning a horizon date for the end of city emergency measures at July 1st, and we've been aligned with that horizon date. As the economy reopens, travel will increase, transit ridership will increase, and the Transit Service Recovery Plan has been developed to accommodate the increase in ridership and to keep customers and staff as safe as possible. Next slide, please. So a few words about the current transit service we are operating. Since late March, we have been at about 15% or about 85% down from our usual ridership levels. We have seen a slight increase in May. We're now at about 20% or 80% down from our usual level. This is all the result of job losses, people working from home, distance learning from universities and schools, reduced shopping, canceled events. At the end of March, we reduced transit service by about 50%. And since then, as we've added more service to provide more space and more capacity where it was required and to provide more connections where they were required, we're now at about 60% of our normal service levels. Next slide, please. The service adjustments that we brought in at the end of March created a reserve of transit staff in case illness had become much more widespread than it has. If we needed staff who hadn't been exposed, they were the staff who were in reserve at home, and they were alternating week on, week off. But throughout this period, we did continuously maintain service to all parts of the city and include service for essential workers and to essential services. And we adapted our service as required to maintain that essential service. The next slide, please. So now I want to move on to a few slides about how we can move to keeping everyone as safe as possible on the transit service. Next, please. The main 8 items: we will continue the enhanced cleaning of buses, trains, and stations. We will install, and we have installed, barrier shields at operator cabs and buses so that we can reopen the front doors of buses. We will require customers and staff to wear non-medical cloth masks if approved by the Commission today. We will post signs reminding people to wear masks and reminding people to do their own self-assessment before entering the transit system. We are installing hand sanitizer dispensers at stations. We will have measures in place to control the flow of buses so that we're not bringing too many people into the busy transfer stations if they're not able to move out smoothly. We'll encourage people to use the touch-free methods of fare payment, and we're working on ways of making the fare payment system more touch-free. And we'll show you ways that we're increasing the space on board buses and trains. Next slide, please. So first of all, enhanced cleaning. This has been in place for some time, but as we put more buses and more trains on the road, there will be more vehicles to clean every day. And as more people travel on OC Transpo, there will be more to clean. So we are cleaning all vehicles around the clock, cleaning stations around the clock, and also cleaning employee areas. This includes disinfecting common touch surfaces. I'll show you some pictures later. Every 8 hours, we're cleaning stations, focusing on high traffic areas and high touch areas. And there are already personal hand sanitizer bottles available for staff, and there's sanitation stations and employee facilities so that our staff are ready to clean their own workplace and their own workstation when they go onto a bus or train. Next slide, please. Here are some photos of enhanced cleaning. You see touch points such as handrails, push bars, and stanch and rails alongside of stairs being cleaned. And you see in the middle the certification sticker that's been applied to each bus after it's been cleaned, so that the bus operator, when they come to pick that up in the morning, know that it's been cleaned by their maintenance colleagues. Next slide, please. These show the barrier shields that are being installed on buses. On the left side, you can see the temporary barriers that have been installed that are made of a thick vinyl that will stop any airflow from the operator area to the customer area, and from the customer area to the operator where the operator is working. On the right, you can see two pictures of the permanent hard plexiglass or Lexan panel that we've been looking at, and that we would be bringing forward to the Transit Commission and the Council for funding as a future capital project. Having these barriers in place allows us to use the front of the bus to give more space for customers to stand in the bus, and also to return to front door boarding so customers can properly pay their fare and ask the operator any questions they have. Next slide, please. Compulsory masks, as you've heard, they help to keep people safe all around us. Ottawa Public Health is recommending a non-medical cloth mask or an equivalent face covering where physical distancing cannot be maintained. And as I've said before, as ridership increases, it will no longer be possible to maintain physical distancing. The province has recommended the use of a face covering when physical distancing and keeping 2 meters distance is challenging or not possible, and public transit is an example. And as you know, the masks retain our own secretions that we produce when we sneeze, when we cough, even as we speak, as I'm doing right now. Next slide, please. So we are recommending to the Commission that a non-medical cloth mask or equivalent face covering be required for all customers and staff on OC Transpo buses, trains, and in stations. Following provincial guidelines, we would apply exceptions for children who are under 2 years old, and for people who have a disability or medical condition that either prevents them from wearing a mask, is inconsistent with them wearing a mask, or that the disability or medical condition prevents them from putting on and taking off a mask. Go to the next slide, please. We are asking customers to supply their own masks, and that is something that is becoming more and more possible. The city's Human Needs Task Force is working along with Ottawa Public Health not to provide masks to everyone, but to ensure that masks are accessible in some way to everyone in the city. For many of us, that means buying them online or buying them at stores. For vulnerable groups who don't have that ability, this is being done by the city providing funding or supplying masks to nonprofit organizations for their distribution to those vulnerable groups. We at OC Transpo are also exploring options with nonprofit and community organizations to make masks available for sale in stations. And also in the first week after June 15th, the date we're recommending to you, we have a limited number of masks available, which we will have at stations and on certain bus routes available for people who may have not been able to bring one or forgotten theirs at home on that day. Next slide, please. This is a sign that we will be putting up on all buses, trains, and stations, reminding all customers of the 2 key points. A mask is required. Don't enter the system if you're sick. Next slide, please. Here's some pictures of hand sanitizers as they have been installed at O train stations, and they're being installed now at many transitway stations. Next slide, please. We have had for many years touch-free fare payment. Customers don't need to touch any equipment to pay a fare. There are ways that they can pay a fare without touching equipment. On buses, customers tap their Presto card or the UPass card on the smart card reader and enter the bus. Customers who are paying by cash drop their own coins and bills into the fare box, pick up a paper transfer from the printer. At O-Train stations, like on buses, customers tap their Presto card or their UPass card or any other smart card on the fare gate, and the fare gate is motorized open. Presto cards can be loaded online or using the Presto mobile app. And on Paratranspo, all fares can be prepaid using ParaPay. Now, there are other ways that people do pay their fares, and I think those are shown on the next slide. Next slide, please. So there is a limited requirement to touch equipment to purchase a fare at an O-Train station. If somebody needs to buy a fare on that day and they use the ticket machine, they do have to touch the screen or touch the pin pad. And so we've got staff cleaning those touch screens and cleaning the pin pad and any other touch points on those ticket machines. But it's also important to recognize that the banks have increased the limit for tapping cards and tapping phones to cover. It was previously $100 at most banks. It's now at many banks $250. That brings the monthly OC Transpo Pass within the scope given by the banks. So tapping a card or tapping a phone it can now replace the need to touch the pin pad. Next slide, please. We are working in several ways to make Presto card use easier in Paratranspo, some administrative ways, and then later on with the cooperation of our vendors, changing the equipment, and we've briefed the Transit Commission on this previously. We're also working with our vendors to allow credit and debit cards to be tapped on buses and on fare gates. This is something that we are moving ahead with, but will take some time to get fully in place. And we're working with Metrolinx, encouraging them in their work to provide virtual Presto cards on smartphones and a number of other things that they are considering to do with smartphones and their mobile app. Let's go to the next slide, please. I mentioned earlier, we are increasing the space on board buses and trains. More space for people to spread out, more space for more people to be on the buses and trains. The first is allowing customers to use the space that's now blocked off at the front of buses and the cab ends of trains. That gives more space, but it requires those other safety measures to be in place, such as compulsory masks for customers and staff and the barrier shields for bus operator cabs. We will increase service on O-Train Line 1. RTG's rectification plan shows that the 14th and 15th trains, will be available in August, and that will mean they're there so that we're ready as the school year begins in September and as more people travel starting later in the summer. Next slide, please. We will keep some buses and operators available to be able to increase service on busy bus routes. So we'll have these resources in reserve as we go into September so that we can add additional trips or move bus types around to operate bigger buses where that's required by observed conditions. And we can do this by deferring some planned service enhancements that we were expecting to make in September. And we just, if we push those off to next year, we can use those resources to beef up service where it's required. Next slide, please. Here's a diagram to show the space that becomes available when we can again return to front door boarding on the buses. The space in green is the space that's now closed off, and that is reopened and provides a lot more space on buses, a lot more standing space, and a few more seats. We do ask customers who are using a smart card like a Presto card or a UPass to still board at the rear doors of an articulated bus or a double-decker bus. And we do ask everyone to leave the bus via the rear doors unless they require the accessibility feature at the front door. And that reduces, these two things will reduce contact between customers and between customers and staff as much as possible at the front door of the bus. Next slide, please. So this diagram shows what we at OC Transpo are doing to keep everyone safer. We at all of the city are doing. The hand sanitizers, cleaning the all surfaces frequently, wearing masks, boarding via the front door, installing the barrier shields, increasing the capacity, the touch-free fare payment, and using masks and face shields on paratranspo. What we need customers to do, it's very simple. Wear a mask when you're on the system and stay home if you're sick. Move to the next slide, please. And so the things we can do to reduce the pressure on the space we have. As I mentioned, we'll have the 14th and 15th trains on line 1. We'll have the buses available. First, we'll increase service, and then we'll have additional buses available to boost the service where it's needed. Different employers across the city may be able to reduce our space pressure by having some customers, their workers, our customers, be at home. Some major destinations may be able to shift work and class times away from peak times. And city staff have been and will continue to be in touch with major employers and universities and others to see where this is possible to reduce pressure. Next slide, please. Now I'll take a small sip of juice here and then move on away from talking about how to keep people safe. I'll move on to our service plan for the rest of 2020. We have 4 steps in this plan. Step 1 is to continue to operate the current service, the reduced modified service, up until the end of this month. Step 2 is to introduce the health and safety measures in place, have those in place starting on Monday, June 15th. Step 3 is to increase our service and return to normal summer service levels on Sunday, June 28th. And the 4th step is to return to full non-summer service at the beginning of the fall on Sunday, August 30th. Next slide, please. So step 1 is to continue to operate the current modified service until June 27th. That is, as I've said earlier, approximately 60% of our usual weekday service. There are no school services operating right now. And for most of this time, it has proven to accommodate most customers at the current very low ridership levels. But as I've said earlier, any substantial return to work or broadening of essential service definition could result in crowding that would make the physical distancing recommendations no longer possible. So our step 2, next slide, please. Next slide, please. Sorry, one previous, thank you. Our step number 2 is to introduce the health and safety measures at the middle of June, requiring customers and employees to wear non-medical cloth masks or equivalent face covering when they're on OC Transpo, to have all the barrier shields installed on buses, to reinstate front door boarding, allowing more space for customers to practice the physical distancing, to have the hand sanitizer dispensers available at O-Train stations and most transitway stations, to continue to have paratranspo operators wear surgical masks and face shields until no longer required, and to continue to operate paratranspo service as long as we can with only one customer on a bus or in a cab at a time, as long as this does not result in us denying trips to any customers. Next page, please. And then at the end of June, we would go back to normal summer service. That would put all bus routes in operation across the entire system, the same route network as was operated from January to the end of March this year. We would include the adjustments that were made in January and last fall to address a lot of matters after the Line 1 opening, but it's also slightly different than what was operating in March because Line 2 has now been closed for construction and Rideau Street is closed for construction, and we've got service modified in those 2 areas. That brings us to approximately 95%, just where we would be every summer, with slightly reduced frequencies on the busy routes, reduced frequencies also on the routes that serve university and colleges, and no school service. We're recommending that this service level begin on Sunday, June 28th, so that it's in place before the city's planning horizon date for the targeting lifting some of the restrictions on July 1st. And we will operate event service as decisions are made about football, about events at Canadian Tire Centre and across the city. If required, we will operate the event service as we normally would. The next slide, please. And then at the end of the summer, we would return to normal fall service. That would again be all bus routes in operation, the same bus route network as would be operating during the summer, including those adjustments after the Line 1 opening, the Line 2 replacement buses, and the Radio Street detours. Very similar to where we were back in the winter. The same similar frequencies as in the summer on most routes, but including the school services and adding back the full frequencies on routes serving universities and colleges, except that we of course will stay adaptable there to do the right things as we hear what universities and colleges decide about attendance at their facilities. We expect to have 15 trains available on Line 1 to give more space and give more room for people. And we will of course bring back the standby buses, the 20R1 standby buses that we had back in the winter to protect customers in case of problems on Line 1. We're recommending to start this service level on Sunday, August 30th. That's based on what we currently know as the planned first day of school for secondary schools and elementary schools on Monday, August 31st, ahead of Labor Day this year, unusually. But if that date changes, we can adapt as well. We're also, as I mentioned earlier, recommended to defer the service enhancements that we were planning for September. Those were new routes and some route changes that we had been developing in discussion with councillors. So we're still going to continue those discussions. But if we keep those resources available, that gives us buses and operators that we can use to increase service where required to provide more space on board. Next slide, please. We've closed our customer service centers at the end of March, and we are recommending reopening. We're planning to reopen the customer service center at Rideau Station when that's possible. That will depend on when it's possible to reopen retail space in shopping centers. But the Rideau Center customer service center is important for customers because it's somewhere they can go to get photos to prove their eligibility for discounted fares, where they can go to have discounts set on their Presto cards. They can go for a replacement of Presto cards. They can drop off their applications for EquiPass, Community Pass, Access Pass. These are all functions that we're providing only remotely now, either over the phone or by mail or online in some cases. Staff at the customer service center will work behind a barrier shield. We will work with the Rideau Center to manage queuing. And we will, of course, apply the city corporate standards for workplaces and for client service centers. For the moment, we will keep the other 3 customer service centers, those at Place d'Orléans, Saint-Laurent Station, and Lincoln Field Station. We'll keep them closed, and we'll continue to monitor customers' needs in that area as the situations change. But at the same time, we are working, and it's other projects we have to enable more of the work that requires people to go to customer service centers to be done online. Let's go to the next slide, please. So here are the steps in that process. Step 1, the current service, the current modified service, running until the end of June. Step 2, bringing in the health and safety measures, including mandatory masks and return to front door boarding at the middle of June. Step 3, return to full summer service with all bus routes in operation starting at the end of June. And step 4, going to fall service with all routes in operation, including school routes, and 15 trains on Line 1 starting at the end of August. Let's go to the next slide, please. So a few words about the reviews, the comparisons we've done, and the next steps for us to take. Next slide, please. Ottawa Public Health has been reviewing this with us for some time. They've identified 3 primary risks: that physical distancing is hard to maintain on board and in stations as ridership increases, that there's a need to ensure customers positive community-oriented behavior when they're on vehicles and in stations, and that there are multiple high-touch surfaces, and there's potential exposure to many other people. So as they've noted, this plan includes several ways to mitigate those risks: reducing total and peak ridership by the gradual change by providing more space, and by working with major employers and other destinations to shift their times of travel, by requiring universal non-medical cloth masks for customers, by providing staff protection for operating staff and for customer service staff, by cleaning and avoiding the need to touch high-touch surfaces, and by conducting a public-facing communication strategy and an employee-facing communication strategy. Next slide, please. We've also screened the entire plan against the city's equity and inclusion lens, and many of the points that the equity and inclusion lens would focus our attention on have been addressed. There are three that that we need to address and need to continue to address going forward. We need to make sure that customers with who are in a vulnerable situation, who have low income, who have a hard time getting masks, that they do have access to masks. We have to continue to respect that there are people who wear face coverings that they wear as part of their belief system, and that those may be adequate or may not be, and they'll have to judge whether that face covering meets medical requirements. And we will be spending time working on how we replace communication or how we supplement communication, verbal information, for customers who are deaf, of hard of hearing, who normally read lips of our staff, people who they're interacting with. And if our staff are wearing a mask, there's a barrier that we have to find a way to bridge. The next slide, please. So there are a number of watch items, and here are 5 of the top things that we have to watch as this rolling wave plan may need to be adapted. We need to continue to watch the provincial decisions on reopening businesses. Because we're Ottawa and so many of our customers are federal workers, we need to watch the federal decisions and how they're going to reopen those major workplaces. We need to watch the provincial decisions on reopening schools, the decisions by the universities and colleges and how they're going to conduct lessons. And of course, continue to watch all public health advice and restrictions as the situation evolves. The next slide, please. There are costs that we're incurring. We're managing those costs, keeping them in control. But there are funding, and you've heard about this previously from the city treasurer, that there are costs that will need to be funded. Some of those costs are enhanced regular cleaning, reactive cleaning after a positive test. Protective equipment has a cost. The hand sanitizer and the dispensers have a cost, not only to install, but also to continue to support and maintain. And the barrier shields on buses, I showed you the temporary thick vinyl and the permanent harder material. These are some of the costs. Communications is an important next step for us. A comprehensive communications and marketing plan will be undertaken to inform customers, staff, residents, and to help you to do the same, and any other stakeholder groups that we can. We'll be centering those communications on the new requirements that will be in place when using transit and the health and safety measures that we are taking to keep everyone as safe as possible. And we will be using a variety of communication channels and tactics to ensure that we connect with all customers. The next slide, please. So this slide and the next slide list a number of the things that we are doing, the health and safety measures that are in our plan in greater detail, those that are in place on the train, those that are in place on the bus, on the next slide, those that are in place in the station, and those that are in place for our staff. So you'll be able to review those later. Now, I'd like to ask the chair's office to start the video if they can. This video is one that we are ready to start to share, depending on your decision on our recommendations today.
Okay, so we're good to go with the video, I believe. Thank you, Mr. Scrimgeour, for the excellent presentation. Chris, are you ready?
Just a moment, Mr. Chair.
Thank you. So maybe just to fill the space here, a reminder to commissioners that after the video, we will go to delegations, and then we will take your questions to staff after that.
And Mr. Chair, it's John Manconi. Just after the video, I just have a couple of points that I wanted to also finish off with. Okay, if I could, please.
Absolutely, Mr. Manconi. We'll do that first.
Mr. Chair, just having slight technical difficulties. I'll just take one moment more with your patience, please.
Caitlin, would you want us to maybe take a 5-minute break and 10-minute break and come back?
Mr. Chair, I believe we're good to go now.
Perfect.
People and will be essential to moving our city. Public transit moves people and will be essential to moving our city forward during the economic recovery. La bonne nouvelle, grâce aux mesures qu'a mises en place OC Transpo en étroite consultation avec Santé publique Ottawa, tous nos services reprendront dès le 28 juin. Starting June 15th, customers and OC Transpo staff must wear cloth masks in stations and on-board trains and buses. Paratranspo operators will wear surgical masks and face shields. Please put yours on before getting on. Des distributeurs de désinfectants pour les mains sont installés dans toutes les stations de l'Autran et dans la plupart des stations du Transitway. Les usagers sont invités à les utiliser avant et après leur déplacement. Protective shields have been installed around bus operator cabs, so customers can board and pay fares at the front starting June 15th. L'achalandage créé par les autobus dans les principales stations de correspondance sera contrôlé afin de réduire autant que possible l'affluence dans les stations et les quais d'embarquement. Enhanced and approved sanitizing and cleaning of trains, buses and stations is happening around the clock. On rappelle aux usagers qui ne se sentent pas bien de ne pas utiliser les transports en commun.
Hi, I'm Dr. Vera Etches. Let's each do our part. Wear a mask, sanitize your hands, and stay home if you're sick.
We're good to go at OC Transpo, so put your masks on and let's go.
Mr. Manconi?
Thank you, Mr. Chair. Mr. Chair, I just wanted to add a few things to the masks discussion. A reminder that it's cloth masks or approved equivalents or equivalents, which is a combination of things. But access to masks, again, is something that's come up, and I just want to emphasize we're doing some great work with the human task force group. So we will ensure that they have a supply of masks for those that cannot afford one, don't have access to one, and so forth. So that's with Donna Gray's group and Claire Ferrer, who are doing great work with Mr. Scrimger. The other thing that we are just finalizing the details on, and again, it is a rolling wave plan. Things are very dynamic. We have a partnership with the United Way, where we will have United Way at our key stations or at stations. We don't have the final list yet, selling them at nominal costs as part of the program. So there's also another avenue there. So in terms of access, it's you can buy your own, make your own. You, if you can't afford one or don't have access to one, you have the Human Needs Task Force. We'll have United Way selling them. And then also we have a limited supply for the first week or so, depending on uptake of those that forgot their mask or we're doing as part of our education campaign. So I just wanted to emphasize that, and the United Way piece is evolving very quickly, and we hope to have that in place in time for the rollout. Thank you, Mr. Chair.
Thank you, Mr. Manconi. Now we'll go to delegations. I'll advise the members that we received 2 correspondence from residents, one from Jan Lamb and the other one from the Federation of Community Associations. You should have both of those available to you. Our first delegation at the meeting today is Philip Turcott, representing the Accessibility Advisory Committee. Mr. Turcott, are you there? Chris, do we have Mr. Turcott in the meeting?
I've just added him as a panelist, and he should be speaking momentarily.
Thank you.
Good morning, everyone. Thank you, Mr. Chair, for the opportunity to appear before you today. I'd like to start out by wishing everyone a happy National Accessibility Week. which is our city's first and our country's first since the passing of the Federal Accessible Canada Act. Just by way of reference, so the mandate of the Accessibility Advisory Committee is to fulfill the duties of an advisory committee as outlined in the Accessibility for Ontarians with Disabilities Act of 2005. And also importantly, Council has mandated our advisory committee to provide advice on programs, policies, and services provided to persons with disabilities and seniors in Ottawa. The majority of the committee, which I have the privilege of chairing, is made up of persons with disabilities, people living in Ottawa with disabilities. We have 11 full members, 3 reserve members, and our councillor liaison, Councillor Luloff, who I am pleased is here today as well. With respect, I have to say that the committee regrets that it was not consulted in the development of this plan. Transit issues and transportation issues have always been part of our work plan. And I believe that to date we've been able to work with staff and provide some valuable feedback. Unfortunately, not in this case, but that being said, I have reviewed the staff plan before you today and will do my best to share some concerns as well as some recommendations. It is unquestioned that transit is an essential service, and that is especially true for our vulnerable population of persons with disabilities and seniors. And it is also true that public health emergencies like the one we are going through can exacerbate existing incidences of discrimination and barriers for those communities. With respect to OC Transpo, as noted, the requirement to wear a mask, which may be necessary, can create a barrier for those who are deaf and hard of hearing and who rely on lip reading. As mentioned in the report, not everyone will be able to independently put on or take off a mask. The plan also does not address prioritization of elevators, which is essential for persons with disabilities and those who cannot use stairs. The plan also does not mention any proposed wayfinding or paths of travel that would be different from the usual, so it's not clear whether those will be in place. And the return to front door boarding on OC Transpo buses may increase the risk for those who need a cooperative seating and who cannot move away from other passengers and maintain social distancing because of that need for seating. In terms of paratranspo, I now see that the website has a Q&A on COVID measures, which is great, but which I will note was not in place until too recently. Customers are also in close contact with drivers, including for fare payment and securing of mobility devices. And customers still have to exchange certain information with drivers, such as their Presto card, as well as proof of payment for Presto, which requires handling of documents and exchanges back and forth. And so not all passengers can make use of ParaPay on Paratranspo. In terms of recommendations, for OC Transpo, it's essential that there are proper training, as was mentioned, for those for providing services equitably to those who cannot use masks to ensure that no one is denied service because of a medical reason for why they cannot use masks. Elevators must be prioritized for those who cannot use stairs, and passengers and commuters should be encouraged to use the stairs by default when able to do so. If there is to be different wayfinding or different ways of navigating the stations, signage must be clear and information provided in a way that's accessible for blind persons who will not be able to view or read signage. Hand sanitizers must be made accessible and placed at accessible heights. And I would recommend that cooperative seating at the front of the bus be maintained only for those who need cooperative seating. And so no one should be standing at the front of the bus to allow vulnerable persons with disabilities to maintain proper social distancing. In terms of paratranspo, the current site states that masks are not mandatory on paratranspo. And so if that is different from regular transit, that should be made clear so that there's no confusion for passengers. Measures should also be in place for those customers whose accessibility needs require them to use the front passenger seat and who would be in close contact with drivers when doing so. And we may need better measures when booking paratranspo trips, as some destinations like workplaces will now be using, oh, excuse me, I recognize that I'm over my time, but I will be done just shortly. destinations like workplaces may now be using different entrances for entering and exiting buildings. And so that must be flexible in paratranspo booking so that persons can book with those realities in mind, as they will no longer be using one door for entering and exiting their building and being picked up by paratranspo. And finally, requirements to check fares for Presto card users and filling out of payment slips, as drivers usually do, should be suspended during the pandemic to ensure proper social distancing for those users using Presto. I thank you again for the opportunity to present today, and I'm happy to take any questions that you may have.
Thank you very much for your presentation. For commissioners, if you remember to use the raise hand function on Zoom, we'll get to your questions. Mr. Manconi, would you like to respond to that first, please?
Yes, Chair, thank you. Mr. Turcotte, I listened to your comments and you are bang on just about every single one of those. We should have engaged with you, and I apologize, we did not. I can assure you, Mr. Chair, members of the Commission, many of the initiatives that Mr. Turcotte's identified are part of the plan, but nonetheless, I will instruct staff that we will engage with you and other members of the Accessibility Advisory Committee immediately. It is a rolling wave plan, so nothing's cast in stone and we can adapt, but your ideas of the signage, the elevator pieces and so forth, they're all part of the plan, but we will immediately engage with you and get your comments and suggestions, incorporate them into the plan. Thank you for your comments.
Thank you, Mr. Manconi. Councillor Kavanagh, please.
Thank you. Thank you, Chair. And thank you, Philip, for your presentation. That was great to hear from you. This is more of a question for Mr. Manconi about what you just said, and I appreciate, because Mr. Manconi just made those comments, if we could integrate in, when we talk about equity lens, that we can make sure that the equity lens includes disabilities and accessibility as well from now on forward, so that it's an automatic, because you did go out of your way to mention that earlier, and if that could be possible on behalf of what Mr. Philip has just said.
Councillor, absolutely. For us, it is an automatic, but unfortunately we missed a step here. We should have reached out to Mr. Turcotte, and again, for that I apologize. But absolutely, the plan's got many of those elements that he's listed in there, and we can incorporate it as we go also.
Thank you very much. Thank you, Philip, for bringing these concerns forward, because with paratranspo, we do need to have extra care, and I appreciate you raising them. In terms of the cooperative seating, what do you suggest that could be pushed in terms of further emphasizing the importance during this challenging times?
Thank you, Councillor, for the question. I think one of the key aspects to this will be public messaging. I think the city does a good job already of including messaging around the use of cooperative seating, but this will be, I think, increasingly important in this time, and perhaps to focus the messaging on encouraging users or commuters to, excuse me, if they are able to stay to the back of the bus, so that those of us who have no option but to use cooperative seating, and who may do so, with walkers, with mobility aids, with wheelchairs that take up increased space in those in those already tight corners and the front of the bus. I think the messaging will be key, so that even if the space is opened up, the expectation would be that if you can, you move to the back of the bus to allow those who need the cooperative seating to use it and to maintain social distancing where possible.
Thank you. You mentioned about those who cannot wear masks, and this was mentioned also by Mr. Scrimger. Do you have any suggestions on how that can be identified? Because I suspect that there will be people that don't want to wear masks as well, and it will be difficult to distinguish from somebody who I guess we just have to take people's word for it. But do you have any suggestions on that?
Thank you for that question. Unfortunately, I don't. I recognize that challenge as well, and I would hope that people would be wearing masks by default unless they are unable to, because certainly People with disabilities, as we know, can have underlying health issues that make them particularly vulnerable in public health emergencies. And so they would also be more at risk if people choose not to wear masks simply because there's no way of enforcing it. I would just note, I think that on mask, for those of us with disabilities who are able to wear them, I would hope that the short supply that we do have will be prioritized for equity-seeking communities. And I think Mr. Manconi has indicated that that will be the case. But again, perhaps public messaging on that front as well, because there is a concern that those of us who cannot wear masks or who would not be able to navigate stations in the typical way may face increased stigma or scrutiny or confrontation from other passengers who may not understand that we're not choosing not to wear a mask. We simply can't for accessibility reasons. So I think public messaging on that front would be important as well.
Well, thank you. And thank you for the work of your committee.
Thank you very much.
Thank you, Councillor Kavanaugh. Commissioner Caricato, and I'll just say the next delegation up, if we could get ready, is Christine Santelli. Go ahead, Commissioner Caricato.
Thanks, Chair. And thank you, Philip, for your presentation. Just a quick question. If you or anyone from your community has noticed a difference between taxi para rides and regular para rides. So when a taxi is used to supplement, if you've noticed a difference in sanitary conditions or the driver or what have you.
Thank you, Commissioner, for that question. Myself personally, and those members who I was able to consult before today, I've been fortunate enough to work from home, and so I haven't needed to use paratranspo so far. But I would say I think the main issue of concern is the close confines in a taxi by nature that are especially, as I mentioned, for those of us who may need to use the front passenger seat only for medical reasons, we will be in close contact. So I think the importance there would be perhaps to require, maybe it's already the case, I'm not sure, require drivers to sanitize as normal between each passenger. To make sure that that's, that the conditions in a close quarter like a taxi are as safe as possible. And it would also be, I think, essential. I understand that currently it's one passenger per trip. But if that changes, if there's a decision at some point to put more than one passenger in a vehicle, especially in a small taxi, that will need to be clearly communicated ahead of time, as some passengers for health reasons may be unable to use paratransport or taxis at that point if they have to share it with another person. So those sanitizing between passengers and clear communication if the policy does change away from one passenger per trip, I think are the main concerns that I've heard in terms of taxis.
Excellent, thank you.
Thank you, Commissioner, and thank you very much, Philip, for your presentation. We'll now go on to Christine Santelli, please. Chris, is she there?
Oui, vous m'entendez?
Perfect. Go ahead, please.
Bonjour, Monsieur le Président Houblé, ainsi qu'à tous les membres de la Commission de transport en commun. Mon nom est Christine Santelli. Je suis une résidente d'Ottawa-Vanier et une membre de CAWI, IVTF, City for All Women Initiative, une ville pour toutes les femmes. Aujourd'hui, je vais parler en mon nom personnel. Merci pour cette opportunité de pouvoir vous donner mes commentaires, questions et préoccupations. J'aimerais remercier le personnel de la Ville d'Ottawa pour avoir traduit ce rapport en français afin de permettre aux résidents et aux usagers francophones de mieux saisir et comprendre ce plan de reprise. J'aimerais également remercier tout le personnel d'OC Transpo et en particulier les chauffeurs pour avoir continué de donner le service de transport en commun, même si le service est réduit. Il a permis à des gens comme moi, qui dépendent entièrement du service de transport en commun, de continuer à aller faire leur épicerie, à se rendre à leur pharmacie, ainsi qu'à différents services essentiels. When you mention in this report the use of mandatory non-medical masks, you mention a video showing how to safely wear face cover. It would be good if this information were available to all those who do not have access to the internet and will not be able to see this video. Also, it would be good that information is offered on how to wash their non-medical mask and how to take off safely their non-medical mask. You mentioned in this report that in the first week after June 15, when wearing the mask will be mandatory in public transit, OC Transport will provide a limited number of masks to people using the transit system. Where will transit users find these masks, and how many masks OC Transport will they have at their disposal? You mentioned also in this report some disinfectant dispenser at the transit way station. Which transit way station? Where will they be located? And when will we see and find these disinfectant dispenser? I'm pleased to learn that cash will be accepted as a method of payment. If wearing a non-medical mask is mandatory as of June 15, what will users who do not have access to a non-medical mask do? Since OC Transport will only provide masks 1 week after June 15. In this report, you mentioned client service center like the Rideau Center to offer service such as Equipass request, the community pass. At the moment, the Rideau Center is not open and may not be open on June 15. What will low-income people who have no credit card or debit card do to pay their community pass or other pass? One of my concerns also is how long does a non-medical mask remain effective during an entire round trip, including transfer? About the user who use medical masks, is there a way to reuse them or should they be discarded after use? Thank you for listening and answering my question and my concern. Passez une bonne journée.
Thank you very much for your presentation. Mr. Manconi, would you like to respond to any of that before we go to questions?
Certainly, Chair. Merci beaucoup, spécialement pour les comments sur les conducteurs qui ont travaillé tellement fort. With respect to the videos and the instructions, how to use them, wash them, and so forth, absolutely, it's going to be available on all modes, all forums, because we know some people don't have access to the internet, particularly with the restrictions on libraries and so forth. So yes, to all that. In terms of the number of masks we will have for the orientation phase-in period, that first week, we're ordering 200,000 of those disposable masks. And again, those are not intended to be giveaways. Those are for, you know, the first couple of days, recognizing some people may have forgotten their mask or so forth. We ask people not to depend on that. In terms of access for people that can't afford one or can't get one, we have multiple streams, including the Human Needs Task Force, the United Way, the vendors on the internet, and also we'll have information in our education campaign if you can't access the internet and so forth. And in terms of the Rideau Center, we are in lockstep with them in terms of when we can reopen in there. And in terms of if in the event that we can't reopen, I can assure the speaker we will leave nobody behind. Whatever we need to do to make sure that you can renew your subscriptions and so forth, we will be there for you. So the current plan is with the Rideau Center piece, if you can't go online, we want as many people to go online, but we know some people cannot. So I think, again, all great comments. And when you see the education campaign is very extensive, we will be pushing out all those messages, which are very, very important. Thank you, Mr. Chair.
Thank you, Mr. Manconi. For questions, we have Councillor Kavanagh. And maybe before you start, Councillor, I'll just say the next delegation up is going to be Maureen O'Halloran. Go ahead, Councillor Kavanagh.
Merci beaucoup. Et merci beaucoup, Christine, pour votre présentation et toute l'information. Avez-vous les suggestions pour d'envoyer le renseignement sur la situation maintenant pour les masques, pour les connaissances de les gens qui a besoin d'aide pour ça? Merci.
Can you say it in English? I didn't quite. Je n'ai pas saisi complètement votre question.
Okay. In English, do you have any suggestions on how to send out information to those who don't have internet? In terms of how you would know people would get the information?
That's a good question. It's very hard. I don't know how we can reach the homeless people. Maybe some organizations are more connaissant or know more how to reach them, and especially the homeless people. Yes. Okay.
Well, thank you very much. You mentioned about punishment, and that's a question I would like to ask as well, in terms of especially those who may not know or somehow miss all the steps of getting a mask. It's a question I'd like to ask Mr. Manconi or Mr. Scrimger of what are the punishments if somebody doesn't have a mask?
Well, after delegations, Councillor, we're moving to questions of staff, okay?
Okay. All right. But that was raised by our delegation. Anyway, thank you very much for your presentation. Merci beaucoup.
Merci.
Thank you, Christine. So Maureen O'Halloran's up next.
Yes, I am.
Go ahead whenever you're ready. Thank you for coming.
Thank you very much, sir, and good morning, Mr. Chairman and Commission members. My name is Maureen O'Halloran, and I am an ex-RCAF officer and management consultant here in Ottawa. I'm here today to express my rather grave concern for the physical security of OC Transpo drivers when masks become mandatory on the 15th. You may have heard, to date, there have been several instances of mask arguments escalating into violence in both the US and here in Canada, at least 2 of which have involved public transit. The latest was only last Monday in Tillsonburg and involved an assault in a grocery store. As a result, I've heard from friends and acquaintances involved with OC Transpo and their very worried spouses that they're already concerned with what they perceive as a reluctant response from OC Transpo security and feel a corresponding need to contact 911 directly when they feel threatened. And perhaps this is coming from a need to keep staff in reserve, as mentioned earlier. They've also identified lack of communication as an issue. Now, I'm fully aware that this is just one perspective and may not be the whole picture, but I felt that it was sufficiently important to merit being brought forward to this body, given the amount of fear that was expressed by the spouses. Having reviewed the report on the plan, I can see there's been enormous work put in on the public health and safety side, which is extremely comprehensive, but that perhaps it is not quite as complete with regard to security and communications elements. For example, this morning, Mr. Manconi mentioned a transition period, but there doesn't seem to be a mention in the plan for a transition period for mask wearing. There's no discussion of who is expected to police the wearing of masks, procedures for non-compliant passengers, things like de-escalation training, and no mention of whether or not extra security would be available, especially during the initial period when I think you could probably expect the most resistance. I also note that there's not any discussion about managing fear and mental health issues on the part of the families. And I would think if you can include these kinds of elements in your plan, it'll be a much stronger plan and a better support for both your staff and families. Having been an RCAF officer and a rear party commander whose job it is to care for families after deployments, I'm very aware of the enormous level of effort it takes to support staff and families in times like this. And I'm also aware of the benefits accrued by doing so. Thank you so much for hearing me today. I'd like to particularly thank Councillor Cloutier, who, after receiving my email on this topic, enabled me to join this conversation and address you all directly. Thank you all for your service to our city, and stay safe, everybody.
Thank you very much for your presentation, and thank you for your military service to our country as well. Mr. Manconi, could you please respond?
Yes, thank you, Chair. Again, great comments, and I'll start with on our greatest asset as an organization, our people. I can assure you, and it sounds like somebody has been concerned about lack of communication, but I don't know if the Transit Commission knows this. Every single employee at OC Transpo gets an email from me every single day about the entire pandemic situation, what we're doing, and what we're working on. The Health and Safety Committee has been engaged on every element of the plan and also every measure we've taken to date, as have all the 3 union presidents. And I can, I'm not bragging or gloating when I say this, I can share with you frontline employees sending me emails every single day of the work they're doing and the fact that it's connecting up with the messaging that management has been giving them. So they're fully engaged, and great comment. If the plan doesn't reflect that, I just want the Commission to know that. With respect to de-escalation and training and so forth, I believe I mentioned in my, I know I mentioned in my opening comments, we are doing a training program. Mr. Richards Brandon, who I introduced at the beginning, has curriculum already written. We're briefing the unions today and tomorrow, and everybody is getting the de-escalation training is important, but what's also more important, I believe, is the compassion and the identification of people that may be in a situation, giving them an opportunity to explain why they're not wearing a mask, not refusing people rides, everything that every speaker, including this one that just spoke, has been saying. So we're fully aligned. It's all part of the plan. The wellness of our employees, again, this is stuff that occurs every single day. We've enhanced all our communication and touch points with our staff. I can assure you that the mental wellness and well-being of our employees has been front and center on every single thing we've been doing, hence the extra care and attention we've been giving to our employees that you've seen, and probably I know some of you have heard about. So great points. Again, all part of the plan, and certainly open to additional suggestions or comments.
Thank you, Mr. Manconi. Okay, thank you, Maureen, for your presentation and joining us today. We'll now move on to questions of staff. Reminder that each member has 5 minutes each. We'll continue to use the raised hand feature in Zoom if you wish to have any questions. And after your 5 minutes, you can place yourself back on the list if needed. So, questions, we'll start with Commissioner Wright-Gilbert.
Hey everyone, I guess I was super quick with that raise the hand feature. Pardon me. So I only have a few questions. On page 7 of the report, details were provided with respect to the enhanced cleaning of the buses and trains and stations, and that all vehicles were going to receive enhanced cleaning once daily, but trains are going to receive additional cleaning every 8 hours. My question is, why are buses only being cleaned once per day as opposed to the trains that are receiving additional cleaning every 8 hours?
I'll ask Mr. Greer to explain the cleaning regime.
Sure. Chair, we clean our buses every day in the evening when they return back in from service as they go through our fueling process. So they are with the interlining of the buses that are out on the road, and that it's very difficult to get them at major stations without affecting scheduling. So as the buses return back in at the end of the day, they're getting a thorough cleaning through our countdown process. So there's more access to those buses at that time.
Okay, so it's a scheduling issue and not a perceived issue with that the trains would somehow be dirtier, I suppose, than buses?
No, it's not. It's more of just adhering to the schedules. If we were to take them and to do a thorough cleaning as we do through the countdown, it would delay the bus. So it would. So what we do, if a bus at any time has a cleaning requirement through the day, it is just called into the control room, and then we would then substitute out that bus. So it is.
Thank you very much. So moving on to page 8 of the report, we're talking about the mandatory requirement for customers and staff to wear non-medical masks. I have a couple of comments. I agree that all customers who are able to should wear masks while using public transit, but I do have some concerns about the mandatory nature of this policy. We've heard that the focus will be on education and not enforcement, but by making a policy mandatory, there is an expectation by the public that there will be enforcement. I assume and I'm concerned by that we're going to rely on OC Transpo employees, including bus operators and frontline staff, as well as what's been called social pressure to enforce this policy. And I'm concerned that it's going to be putting OC Transpo employees and customers in an untenable and potentially dangerous position. I think we need to ensure that any policy with respect to transit and COVID-19 strikes a balance between public health and public safety. So a couple of questions. Are there any other jurisdictions in Canada that are making masks mandatory for public transit?
So there are other agencies that are recommending, but I can tell you my phone was ringing off the hook on the weekend. What other agencies, based on the comments I've heard from the agencies and this morning from other North American agencies and UITP, is that we appear to be the first agency that has partnered with the public health officer in terms of bringing the right piece forward, in that we're being very deliberate in saying that social distancing is not going to be possible any longer. And so therefore, if not masks and if not social distancing, what else can we do? And so if going forward without making masks mandatory, we are going to put people in harm's way, as you've heard the medical professionals say. So I can tell you across the world, there are many other agencies that are making masks mandatory. I believe as ridership increases, it will increase in terms of mandatory. To the south of the border, there are many agencies that are doing mandatory: New Jersey, WMATA, which is Washington, and others. And I can tell you that those panels that I sit on, both the North American one, the international one, and the Canadian ones, are all waiting for this report today because they're saying it as one of the best in class in terms of a balance. And I can assure you, Commissioner, our goal on the training, the de-escalation, the dialogue is not to put anybody in a confrontational situation. And the analogy I bring, Dr. Etches has coached me along on a lot of things. And one of the things that I admire about what everybody in Ottawa has done is the 2-meter rule just became natural. It was something unheard of before this pandemic. And that's how I look at success on this mask, is that if you can wear one, you don't have that medical restriction and so forth, we need you to do your part. So I believe that the residents of Ottawa will respond. We're not going to have mass police. Yes, we can invoke fines and so forth, but that's not what we're going to be doing. We're going to be asking everybody to do their part to help the city of Ottawa get the pandemic under control, to recover the economy, to get people to their essential places of employment, and to move about the city.
Thank you, Mr. Manconi. How is this mandatory policy going to be enforced? What is the plan for that?
The plan is the education piece to the customers and to employees, in that you create an environment where there's information, you ensure access, which we've done, and again, it's a rolling wave plan. So if there's other opportunities to increase access, have other vendors out there and so forth, we'll do that. It's also about ensuring that everybody knows that not everybody can wear a mask, and how to identify those things and how to have those discussions. And then it's about messaging in terms of saying this is important for everyone and for the pandemic. And the consequences of not wearing masks is we could have additional spread. And as Pat, I don't know if people picked up on it, we may have to revert back and have less transit when we're trying to get people to those important places of employment, when we're trying to get recovery going, when we're trying to get people around. So explaining all that in the campaign and being very collaborative is the approach we're taking.
So it sounds more like a public education campaign rather than enforcement of a mandatory policy. So when we use the word mandatory, there is a public expectation that there is going to be enforcement of a policy that says you must wear a mask unless you're not physically able to. So my question is that will there be zero enforcement, which is what it sort of sounds like, that it's more of a public education campaign, or will there be people approaching customers saying, you're not wearing a mask, why are you not wearing a mask? Or did you know you have to wear a mask? There's a very big difference between public education and then sort of a confrontation with riders. Confrontation, is probably the wrong word, but a conversation with riders, individual riders, about not wearing a mask. And so my question is, what is the level of enforcement on this mandatory policy?
Oh, great question. So here's what's going to happen on the training. All frontline staff, so the supervisors, superintendents, the people that are out on the system, special constables, will have additional masks, disposable masks with them. So let's say that you're on the platform and you're not wearing a mask. They're being trained on having a discussion with you to say, hi, did you know you have to wear a mask? Oh yes, I forgot it at home, as an example. Here's a disposable mask. Could you please consider wearing that mask? Can you please wear that mask on the system? So again, it's about having that dialogue. So the enforcement piece is about talking to people and talking about the requirement for mandatory use of masks on the system unless you have restrictions that preclude you from doing that. So I think we're saying the exact same thing. It is, our recommendation is mandatory. Public health supports that. The industry is supporting that in other areas where they're ahead of us on the curve. And our challenge, that is your challenge as the board, is you will not be able to social distance anymore. So you either cut service, shut down the system or reduce the system, or go to the mandatory mask piece. So it's a difficult decision, I understand that. But going out with a heavy hand in terms of finding people and so forth in the early parts of this is not our intention. It's to do what you've suggested, talk to people, give them access to masks, have extra masks available. And I believe in our customers, and I believe in our staff. I know our staff can do this. And when Dr. Etches speaks, Chair Eglai speak about this pandemic, everyone in Ottawa has stepped up, and that's what we want to work with.
I agree with you, Mr. Manconi, that a heavy hand with enforcement is absolutely the wrong approach to take when it comes to asking our customers to wear masks and to continuously wear masks. The mask issue is somewhat divisive. It shouldn't be, but it is, unfortunately. And so my main concern is really for the safety of OC Transpo employees and our customers, to ensure that there's not confrontations between customers on the buses or people having to disclose their medical conditions because they're not able to wear a mask. So I appreciate that it's more of a public education focus rather than heavy-handed enforcement. And I think that message should be put out to customers as well, that this isn't about heavy-handed enforcement, because I think that people may have the temptation to perhaps confront other riders about not wearing a mask, because it is a bit of a divisive issue. So thank you. So with respect to increasing space on board buses and trains, and just for reference, that's page 10 of the report. Can you provide more details with respect to the additional capacity to increase service?
1 minute.
Thanks. How many buses or drivers will be on standby, and where will they be located?
Pat, could you please speak to those?
Sure. The buses and operators that will be available are those that we would otherwise have used for increasing service had there been no pandemic during this year, and they are within the 40 additional buses that the mayor announced last fall. Now, some of those are already committed to other service to changes that we introduced in January, but the rest will be available, and we'll continue to monitor staff levels. We've also hung on to a few buses that would normally have been retired but are still in decent condition. We can keep them in good condition to tide us through this period till we see what the long term where we stabilize.
Finally, on page 12, under the safety measures in place on June 15th, it's talking about how customers who use double-decker and articulated buses who have Presto or U-Pass cards are going to be encouraged to board at the rear doors, but also encouraged to disembark by the rear doors. My concern is that this measure is going to cause crowding and frustrations at the rear doors and completely obliterate the ability for customers to physically distance from one another if they happen to not be wearing masks. It's also contrary to the recommendations from Ottawa Public Health found on page 15, namely consider ways to channel customers within stations and on buses to avoid unnecessary contact. Would it not make more sense to ask customers to board at the front of the bus and disembark at the back so as to ensure physical distancing?
I'll ask Pat to explain that.
Mr. Chair, the best way for us to avoid contact between customers is to ask as many of them to use the rear doors as possible. They will, people will get off the bus first, people will then get on the bus. Those people who need to use the front door, either to pay a fare on the way in or because of an accessibility feature that they need on the way out, will continue to use the front door. The front door will continue to be the busiest door on the bus, and it will almost always be the last point that will clear before the bus can pull away. This is the best way that we can avoid conflict and crowding among passengers in the corridors.
Not entirely sure I agree with you there in terms of asking everyone, essentially, a large majority of our customers. Can I finish my statement? I'm not sure what the rule is there.
Is it a lengthy question, Commissioner? We can put you back on the list, or if you
It's
just
not. I'm
bit?
just responding to Mr. Scrimger's comment about it's the best way. So 15
and then we'll
seconds.
go to Councillor Tierney after your response.
Thank you. So I'm not sure I agree with you, Mr. Scrimger, with respect to is the best way to get our customers onto the bus and off of the bus to sort of avoid confrontation or crowding at the doors. When we're asking the majority of our customers to exit and enter the bus using the exact same door, I'd like some thought to be given to allowing customers to, or instructing customers to be entering at the front of the bus and exiting at the back to ensure customer flow. That's what I would like to be considered. Thank you, Mr. Chair.
Thank you, Commissioner. Commissioner Tierney, followed by Commissioner Brockington.
Great. Thank you very much, Mr. Chair. I'll just get right to the questions, and I thank you, John, for that very thorough discussion. I also had concerns about the enforcement, and especially around, I do agree, masks are the key to getting back to normal, quote unquote, normal transit. But I did have a couple of questions, and there is some good news. I do take notice when I do have to go out at the local grocery store. I think a lot of people are I'm seeing a lot more masks, and as counselors, I know we're going to do a good promotion campaign to ensure people know that, so that's good. But when I noticed in one of the slides, the sanitizers within the stations, and maybe this is more for Ottawa Public Health, I noticed it showed the ones you pull by hand instead of the automated ones that squirt. Is there any recommendation from Ottawa Public Health on that? Maybe the automated ones would be better, so we don't actually have to touch anything at all in the station?
Thank you, Councillor Tierney. It's Brent Mulhoney here. So you're right. I mean, if it was feasible to have non-contact dispensers, that would be preferable. And it is something that we have talked to Mr. Scrimger and folks at OC Transpo about, the future of being able to do that. However, even the touch ones that are showing, once you put the hand sanitizer on your hand, you're actually then cleaning your hands. So even if that touch lever is contaminated, you are then about to then clean your hands afterwards. From a public health perspective, I think it's most important to actually have the hand sanitizer there, and that over time can look at gradual improvements in dispensing mechanisms.
Okay, and maybe just as a follow-up, John, I don't know if you or Pat, if you're looking at that as I only think about it because I notice a lot of stores have adapted their practices to it now. At first, I even walked into a couple of stores and I was touching the top of it and I thought, but now they all seem to be doing contactless, automated, or spray. Obviously, we can't have someone spraying people all day. Do we have an opportunity to revisit that and look at automated ones?
We do, Councillor. This is supply and demand. That's the problem right now. So much so that Mr. Greer, believe it or not, we're actually making our own dispensers now. Wow. Until the supply can meet the demand. Those were the first wave that rolled out in the LRT stations. We told RTG to proceed with them, even though they weren't touchless. I think hand sanitizers are here to stay for a long time. Our plan, again, rolling wave plan. I hate to repeat that term, but it's a very dynamic plan. You'll see us add more, go to the automated ones, and actually convert those as they become available. Our blitz right now is to get the product out there as much as we can.
And I appreciate that. Thank you for that. Also, you mentioned I think 200,000 masks. I just want to be really clear on that. Is OC planning on selling those, or is this just these are emergency masks? We don't want to dole them out. We don't want to have the message, if you forget masks, don't worry about it. We really want to have people bring their masks. But just to be clear, are we selling them, or is this just giveaways?
No. Great question, and I'll clarify that. These are not giveaways. These are not intended to replace people's needs to go and get one. This is in the event that you forgot your mask for those first couple of days. And 200,000 sounds like a lot, but that's not significant given the volume that use our system. Please, we ask the public, don't depend on those masks being there for you as giveaways. Those are for the person that forgot their mask, lost their mask, whatever. And we're again trying to do what many of the speakers have already said, just to work with the community.
So again, are we selling those, or are they?
No, those will be in the event that you forgot your mask. In addition to that, we will have United Way selling masks at locations.
That's wonderful, and hopefully they'll be cost effective. I assume they will be.
Yes.
Okay, great. I also, my goodness, I thought I hopped into a time machine, John. Back in 2013, I had to go look when we were talking about Presto and Metrolinx and all that, bill of goods that they were selling us. And finally, it sounds this might be the silver lining of this entire COVID experience. Did I hear correctly? We're going to have Interact and credit card tap available directly on the buses?
So what we're doing is, we look at what good can come out of this challenging time. And because of the model that we picked, where Presto just does our back office in terms of machines on our buses, and at the LRT stations, we guide our destiny. 2 weeks into the pandemic, our supplier came to us and said, would you like to get in the front of the line of going with open payment? Wow. We said, absolutely. We are negotiating with them right now as to how we do a technology acceleration program to go with open payment. And so you can use your credit, debit, Apple Pay, Google, all that. Don't have firm timelines. We hope some of that will be in place by the end of this year. But the other thing we're doing is we're pushing the industry to go, everybody should be going with open payment so that it deals with the pandemic and also the nice to have issues. So it's coming. As soon as we get details firmed up, we'll share that with you.
Wow, that is super exciting news, especially after we recover and we get back to real life, several months down the road and tourism comes back into play. I see that as a massive win from our front. The video that I saw, how quickly is that going to be circulated? Because I think that's important for councillors to get out there. It was a terrific video, and I think it only benefits us to get that information out as quick as possible.
So I believe we're rolling tomorrow with elements of our comms plan. All of you will receive videos, and that video gets sliced up also into sub videos We'll get you a media kit and so forth. We really need your help in getting the word out.
Wonderful, thank you. And last questions related to the East End modifications to Blair Station. I heard, it ties into the accessibility aspect, especially on the elevator front. Are we still moving ahead on, the extended canopies, the extra elevator that's going to go in there to satisfy that, it breaks down all the time, that old one? Are those plans still moving ahead? Are we taking advantage of this during this period?
Yes, we're moving ahead with all those.
Wonderful. Thank you very much, Mr. Chair, and thanks, John.
Thank you, Councillor Tierney. Next up is Councillor Brockenden, followed by Councillor McKinney. Sorry, Councillor McKinney.
Thank you, Mr. Chair. Can LC Transpo indicate if they've ever required passengers to wear a mask before during serious flu epidemics or other transmissible diseases?
Not that I'm aware of.
And why did you wait over 100 days after the state of emergency was called to come to us with a mask plan?
So we, Councillor, great question. That's come up. We did not wait. Social distancing was very easy to do with the low ridership. And you will recall the position of masks from the medical profession in the early days was that masks were not required. So I can tell you that on day 2 of the pandemic at the Emergency Control Center, my first question to Dr. Etches was, do I immediately issue masks and gloves to all our operators, and do we have to do anything with the customer base? And the answer was no. And social distancing was permitting the requirements of the public health officials. And then a few weeks ago, you heard Dr. Etches speak about if you're using transit and you can't social distance because there was a little bit of uptake in the ridership, consider using a mask. And now we've developed the policy that's before you.
I'm very supportive of the requirement to wear a mask. We've had reports since day 1, though, Mr. Manconi, that some buses have been full because certain routes, certain times of the day. I totally agree with you that our capacity has been low, or the demand, but you get those odd ones that we forwarded on where people have been concerned because social distancing hasn't been a problem. So I'm disappointed with public health. I think this has taken way too long to get to us. I think that the fear of spread has always been there. I'm glad it's here now. You use certain adjectives in your recommendation. You go out of your way to say non-medical cloth mask or equivalent. So if someone wears an N95, why are you specifying the type of mask they need to wear or should not be wearing?
Oh, great question. Brent, again, I've learned a lot through this process, and I would ask Brent to please explain. It was very, very important to us in the designing of the wording, because we're not going to tell people to take your N95 mask off and so. And I'll guarantee you, we're going to have subsets. I bet you're going to see people with motorcycle helmets on and so forth. So, Brent, if you could just take a moment and speak to us about the wording and the fact that other things, if you wear an N95, we're not going to tell you to take that off, as an example.
Sure. Yes. No, thank you for the question. So let me just initially backtrack the timeline a little bit. And I think from a public health perspective, that when it became apparent, and it wasn't apparent right from the very beginning in January, it took time as we learned about this virus, that people were being infectious before they developed symptoms. So as soon as we began to hear that, and the studies were coming out showing that people had virus present and were able to transmit it before they developed symptoms, then the light went off to say, this is going to be a more complex challenge to fight. Then we had the additional information that there were a significant proportion of people who were asymptomatic, who never got symptoms or were incredibly mild symptoms, to not be recognized as being ill. And so when we reached sort of consensus to realize this is what we're faced with, that's where you saw the transition to the recommendations to be wearing masks. And as Dr. Etches said earlier, I would say Ottawa Public Health was out in front of many of our public health colleagues elsewhere, pushing this before we saw the provincial and national levels go along with the same messaging. Now, in terms of the non-medical or cloth mask, this is really related to the shortage of medical PPE, personal protective equipment, that exists in healthcare. And so there's been a conscious decision by public health authorities worldwide, really, certainly in the Western world, to not want medical supplies which are still in tight supply for hospitals, acute care, long-term care, to be diverting medical PPE for the public use. I mean, if we had millions of surgical and procedure masks in extra supply, recommendations might be different. But the reality is that the medical surgical procedure masks, the N95s, need to be held for our frontline healthcare providers who need those. And so the decision has been made throughout North America, Europe, elsewhere, to be recommending non-medical cloth masks. And in fact, at OPH, we've been sort of migrating our language over time, and increasingly we're referring to those as cloth masks. And on our website, increasing amounts of information for the public on how to make them, what to look for, the importance of fit, how to wash them, if you have to take them off momentarily, how to be able to do that and still be able to reuse them, as well as pushing the information out through some non-internet based mechanisms.
What has to happen for this requirement to be lifted?
Maybe I'll take that one first. Thank you for that. I think that overall, if I think back to why did we in OPH begin to recommend to be using masks, is because we were concerned about community transmission. And I think as long as we are concerned that there can be transmission in the community, and then I would even think looking ahead about reimportation. Like, we got into this challenge early on because cases were imported into our community, and it's taken us months of sacrifice by many people to be able to get this under control, to we're at the point now where we can begin to look to reopen. But it's going to be a tight balancing act to be reopening, to increase the opportunities for transmission while there's still disease present in our community, which is why we're going to be monitoring very, very closely as things reopen what happens with respect to disease transmission. So we need to put as many control efforts in place to try and prevent that transmission, and masks in public where we can't maintain distancing is certainly a key approach or strategy required. So I can't give you a specific date. I think that it's really as long as we're concerned that there can be transmission. And I think as ridership goes up and distancing cannot be maintained, then I would view transit services as an area where we'd want to maintain it as long as we have any concerns that transmission can be occurring.
If the criteria you listed are your foundation, then there's probably 18 months, probably a year for a vaccine. Who knows how many Canada will get, how we're going to triage who gets it first. But if that risk remains, probably 18 months. My concern is the public looks at the very, very low numbers of new cases we've had the last 5 days, very encouraging, but don't want to get a false sense of hope. And people start to question, well, why are we still wearing masks when Ottawa's numbers are so relatively pretty good? I mean, I like our numbers. So I am adamantly opposed to this delegation of authority in the motion. Part 2, it says, and continuing until widespread mask use is no longer required in the opinion of the medical officer of health. I don't want this commission or any other body to delegate our authority. We're the people who are accountable to the public to make those decisions. OPH should always be looked at to give us advice, best professional advice, but at the end of the day, it should be this commission that makes that decision. Just to staff, I'm disturbed by the comments that there's a plan to hold buses back to slow down the number of people coming into stations. And I want to have a greater discussion on this because already we have bus reliability problems, and I'm concerned about what the plan is to queue buses and hold back the flow of people in our stations.
Certainly, Councillor, and happy to meet with you to take you through that step by step. Just to put it all in perspective, what that means is not delaying service. It's holding up the queue into key stations. So if you can picture tunnies in the event that we're seeing platforms get crowded or the station getting very crowded, just to throttle down a little bit in terms of them entering into the transfer points and so forth. With the intent of keeping transit moving and the service as reliable as possible. So it's not about cutting routes or delaying routes or of any significance. It's about throttling in and out into key transfer stations. I'm happy to give you more detail on that if you like.
Well, I'm being asked to support this right now. My concern is people miss their connections. We've reduced service. The amount of time for some connections has gone up.
Understand that.
Sitting together on the bus, I don't see the big issue in bringing buses into stations and not holding them up. This causes me some concern. Mr. Scrimger said if there's a second wave, there will have to be less service. So I don't understand why that's the case.
Sorry, would you like me to finish the first part?
Sorry, Mr. Manconi, can you just hang on till whoever has their phone ringing in there can mute it, please?
That was me. I can't mute and talk.
Okay, so your phone was ringing while you were talking into it. Okay.
I'm sorry.
Go ahead, Mr. Manconi.
So, Councillor, just on the first question, it's about controlling crowding at the platforms and at key stations and striking that balance of that, and not missing connections. So it's all about that. With respect to the second piece, is that if things get worse and we have to go back and adjust service, we'll obviously come back to you and talk to you about that piece.
Does the report not state, though, that buses will be held back at stations?
Yes. Can I get Pat to just give you a quick overview? Pat, can you quickly provide an overview of that? Because I think it's being seen as a major delays to service, and that's not our intent.
Thanks, John. No, it's not to delay service. It's to stop the station concourses and station platforms from being overcrowded if there is a delay. So this is how we respond to a delay. It's not to cause a delay. We have seen over the last few months a few occasions when terminal stations, Blair, Herdman, and Tunney's in particular, got very, very crowded in the station because the trains were delayed, but the buses kept arriving and kept bringing more people in. So what we have now at one station, and we'll switch to have it all three, is that we've got a traffic light outside the station that gives the bus operators instructions, wait here until you're called up. So we can just compartmentalize where people are waiting. If they're in the bus, they'll stay in the bus for a few more seconds, and we'll bring them up to the station when the station has room to receive them. It's not about creating any new delay. It's just about making sure that we aren't continuing to pour more and more people into a station that's already very, very full.
I just don't see that becoming a reality in the first few months when our ridership is as low as it is. Are we seeing this as any problem at any station right now? This is probably a 6 to 12 month problem.
Councillor, you're absolutely correct. We don't see that as being a problem now. We're being proactive and looking down the road. If there is a delay with the trains in particular, you've seen those pictures of crowding at those platforms. We don't want to add to that. We've been very, very successful in even bypassing stations as one of the mitigation measures and bringing. It's about doing what we've been doing organically, and we just wanted to share that with you. And you're absolutely correct. I don't see this happening now, but in the event that it does occur, we just have some flow controls that line up with what we've been hearing from people.
My last question is just regarding Mr. Scrimger mentioning the 14th and 15th trains being available in August. Are these trains available now? And if not, how do you know that they will be available in August?
Great question. So you'll recall at the update to council, Mr. Morgan walked you through the train count, the rectification plan, and part of RTG's rectification plan to us is that train 14 and 15 will be available for us to use in August for service. They are available now. They've been tested. They're part of the overall fleet count. You remember Mr. Morgan had that graphic with, we have the vehicles, RTG just needs to get to 15 fully ready for service. We have communicated that with RTG. They're in a reduced service level now, and like bus, they're going to be incrementally stepping through and increasing rail counts. We want that 15th train in service by the end of August, so we can use it for spacing, capacity, service, and reliability. So it is on them. We're checking every single day. Mr. Charter, who's as part of this team, is with them every single day, and Mr. Morgan is holding them to that rectification plan. RTG needs to deliver there. Steve Kanalakis and I met with the CEOs on Friday, and we made it very, very clear to them that they have to get those trains to us.
Just last question, sorry. Have you been approached by OSTA about what school children may be required to wear
1 minute.
when they take school bus in August?
No, but I believe Pat has that on his to-do to connect up with them and see what their plans are.
Okay, thank you very much.
Thank you, Councillor Brockington. Councillor McKenney, before we go to you, if you don't mind, Councillor Eglai, as Chair of the Board of Health, has asked to reply to Councillor Brockington. So if you could bear with us a moment. Go ahead, Councillor Eglai.
Thank you, Councillor, and thank you, Chair. Just very quickly, to respond to Councillor Brockington. Councillor Brockington, I think Dr. Wagney was very soft in his response. Public Health has been monitoring this since the very beginning and has been a leader in how to respond. They've been monitoring the mask issue very carefully, and all along our approach on physical and social distancing has to be get buy-in as opposed to imposing things on people, to work with the community. And I think it's been very successful. And this is a discussion that we've had with Mr. Manconi as well, and it's reflected in the answers that he's provided this morning. I'm sensitive to your comment around us being the elected body, but I think part of our job as being the elected body is to make the best use of the best resources that we have. And we have those resources in Dr. Wagney, Dr. Etches, and the full OPH team. So I don't have any compunction whatsoever in, though I'm not a voting member at this commission, I don't have any compunction whatsoever in looking to those experts to provide their best professional advice as to what's in the best health interest of the members of our community. So I just wanted to put that on the record. Thank you, Chair.
Thank you, Councillor Eglai. Councillor McKenney, please.
Give advice.
Thank you, Chair, and thank you to staff. That was a very good update. Lots in there. Thank you for the work that you've been doing. I know it's not been easy. It's ever evolving, and one of our most front-facing services is transit, and probably one of our most essential is transit. So I just want to recognize the efforts and the difficulty in continuing to provide that service in the safest way possible for everyone. I have 3 questions, and the first is on the masks and on the available masks. It's great that we will have some available at some transit stations, for a nominal fee, but there will always be some people who really cannot afford it. If it's a single parent with a couple of kids, $3, even if we're selling them for $1 each, can be a barrier. So I wonder if staff, I don't have to give any formal direction or anything, I'm sure that you'd be happy to go away, but if you could consider where some free masks might be available for people. Thinking about our housing providers. Our housing providers, are home to some of our, most low-income residents. So if they each had, a number available to them that they could hand out to their residents. Certainly our community health centers also see on a regular basis. Just thinking, we know what the Human Needs Task Force is, and, but for somebody who wants to leave their home, doesn't have a mask, not sure whether there will be one, where they arrive. I'm just trying to think of a way that we ensure that nobody is unable to access transit because of the availability and also the cost of a mask.
Yes, Councillor, and thanks for making the Human Task Force list, bringing those real examples to the table. Absolutely, the answer is yes to all of that. And what would be helpful to me is if you know that industry or that space very, very well, if we'll take the ones you've noted, and if you have others you want to send it to me and Pat, we'll make sure that Claire has that on her list. But I can assure you that Claire and her team have a great database to get out to exactly what you're doing. And again, it's a rolling wave plan. If we miss anything as we go along, we'll add to that. We want to push out and make masks available to those that don't. And I will say this, there is a data right now out in the industry that is being formalized that those most vulnerable in our community have been most negatively affected by mobility issues. And women in particular also has been identified. And so I'm right with you in terms of, let's not add to that hardship. We need to build and bring everybody together as a community and really make this a win-win-win. So you have my my full commitment that is our goal. And Claire and her group have been doing a phenomenal job. We'll add to the list if we miss any.
Okay, no, I appreciate that, and absolutely, the task force and Clara's group have really stepped up on a number of issues. So I thank you for that. And if there's, I'll think through maybe some areas where we could stop people from falling through any gaps. So thank you for that. Second question I have, it came up a few weeks ago. Started to get emails from operators who were unable to find washrooms during the day. That's always been an issue in terms of timing, but certainly as private spaces and even other public spaces have closed down, even more so. Has there been any movement on providing washroom access to operators in our facilities, in the LRT and any other place that we have staff facilities?
Yes, we added to, because what happened, just for others that don't know, the closure of malls and Tim Hortons and so forth restricted access to those facilities for our operators. So we've added to that. We've added portable units. We've opened up some other locations, and there is a process for staff to advise immediately through control. They don't have to go to their supervisor that they're on a run that doesn't have any opportunity that's realistic in terms of a washroom access. So, Councillor, we have that one tagged, and we've rolled out some additional locations.
Okay, thank you. That's great to hear. Whoever knew that the Gotta Go campaign would get such a bump through COVID, right? But it has. It's really shown us where those gaps are. Not just for operators, but for people experiencing homelessness and on many fronts. My last question, Chair, again, it's to Mr. Manconi or maybe one of your managers, just on security in terms of face masks. It's been raised in women's groups who deal with violence against women in particular, the risk to increased violence against women, or just a general feeling of unsafety as a result of masks on people's faces. So what have you just given that any consideration in terms of enhanced security anywhere to ensure that lighting as well, that there's signage for people to watch out for each other? Again, it's difficult times, even when you go out. I know when I go out to walk my dogs or to go out to get something, there aren't as many people around. There's just, there's less people around, so there's the feeling of security is less. And certainly with a mask on, it can add to that. So just wonder if you've given any consideration to those additional security measures.
Yes, we have, and you're bang on. There have been challenges since the pandemic in that when there's less use of the system, things start to occur. And you know, very sad that we have some homeless people that didn't have anywhere to go, so they started to ride the bus. Non-destination customers, they're just on the system and so forth. So we have stepped up our the word security is good, but also our presence to help people, because there are mental health issues out there too. People are feeling it a bit more than perhaps if we're under more normal times. So yes is the answer. The security and the presence. We've augmented our special constables and so forth, deployed some of that staff, and we will certainly embed, and I'll check with Pat to make sure that I think we need to weave some of your messages in there in terms of our campaign. And again, it's a dynamic plan. If you've got some suggestions, we're open to that.
Absolutely. And you know, the Red Vest group certainly have been very helpful for people. So I just want to end by saying that, you know, I support this report. I support the recommendations. I support the recommendation for masks. It's about keeping people safe, and we know that the more that we wear masks in public, especially when we're inside, whether it's a building or a bus or a train, it helps keep everyone safe. So I support it. You know, my concern was just around accessibility and affordability, of course, but I hear that you have taken that into consideration, and thank you for the work and for the presentation today.
Okay, thank you very much, Councillor McKenney. Next up, Councillor Kavanaugh, please.
Thank you very much, Chair. And thank you to my colleagues for your questions. Many of them are some of the things I was going to ask, but I'm glad they got asked. In terms of the masks that are being sold at by United Way, I believe it was, how much? How much are they going to cost?
I just want to ask Pat, I know he's working on the weekend with them, so I don't know if he's got all that nailed down. Mr. Scrimgeour, do you have details?
John, I think it's best for them to say what they're working on. I can say that the principle is that they hope to sell them at a price that allows them to fund the distribution at lower cost or no cost to those who can't afford them. But I think it's better for the organization to say than for me to say what they're thinking of right now.
Okay. In terms of enforcement, you've been pretty clear that it won't be pushy, and I think that's a big concern for residents. I mean, after what we experienced at parks, where we had bylaw coming in and giving people $880 tickets in those first few weeks of enforcement of parks, I think people are pretty nervous about when something is mandatory, and so I think that has to be clear about what levels there are. The other concern I have is sort of other customers who do follow the rules pushing back on others, and you know, conflict, and I've seen it in terms of the park situation, and so I'm just a little concerned about that and how that's going to be dealt with, because obviously if somebody's following the rules and they see others who don't, how's that going to be handled? So and also in terms of legality, on the document on page 17, you say there's no legal impediments to approving these recommendations. I'd like to know how that was checked out, because obviously there are some people who feel strongly about being told to do anything that they, you know, feeling forced to do anything. So I'd like an answer to that as well.
Certainly on the legal review, Mr. White and his team, and I know Taffy is on the line, did a legal review, and we have the authority under the bylaw that you have to follow all of the quote unquote rules that we put on our system. So we asked legal to do the review on that. And in terms of the enforcement, I just want to, echo what I've said in the past. I think this is about proper communication, respect, everybody doing their part. The other thing that I would just add before I ask Taffy to comment is what's on our side right now is ridership is still low. And so let's all work together to, just the community hearing that all of you hopefully support the plan, the Dr. Etches, Brent, and those so forth, the chairs supporting it. Getting that message out, I think, will help us all get there together. I'm an optimist. I believe that people want to do the right thing fundamentally. Yes, we'll have the very, very small percentage that will be against this for whatever reason, other than what they just don't want to do it. But I'll ask Taffy to comment on the legal lens, please, Taffy.
Thanks, John. Chair, the issue on the comment in the legal report relates around the fact that the commission has the authority to approve this report. So there's no legal impediment in respect to that. In respect to our other comment about the bylaw, the transit bylaw is quite fulsome and allows us to continue enforcing and making these adjustments as we see fit. And again, under the general authority of the Municipal Act for health and safety and welfare of the residents. So that's in essence where our comment is relating around. And so if there's any further clarification, by all means. Thanks, Chair.
Okay,
Thank you, Taffy. Councillor Kavanaugh, did you have another question? Or?
Yes, I did. Thank you. In terms of other measures, testing of employees, is it mandatory? Are we going to have regular testing of employees now that there's more availability of tests?
So not yet. That's not in the plans. What we implemented very early on in the pandemic. There is a required self-check that you need to do when you report into work. That's for all of OC Transpo, because as I say, this pandemic has no limits or boundaries. We are now moving into a second phase of formalizing that self-check, whether it's done electronically or a form is submitted and so forth, because we've been leaving it up to the individuals. There has been talk about, and there's been even some asks from some employees about doing on-site testing. We're not there yet. We will wait for the public health officials to guide us in that direction if that's something that we should be doing. And there was other things we looked at, mandatory temperature testing of customers and so forth, which is being done in some other jurisdictions. Those are things that we chose not to bring forward as we didn't see them being a requirement at this time.
Okay, yeah, I appreciate it. I think that builds confidence if we know the employees are being tested regularly rather than waiting for symptoms. As we know, you can catch it and not even know it. So I thank you for that. In terms of just a second here, the ridership, I know that there are some routes right now that actually still have quite a few people on them because they're the only bus to a certain place. And so there's a lot of concern right off the bat on those. Are we going to put some extra attention on those routes? I think we know them. They're particular destinations and for essential workers. And I'm still hearing concerns, such as a bus to Stittsville, for example, from my area. But I'm still hearing concerns about buses being quite full. Is there any efforts to be made to help in those situations right now?
The answer is absolutely. We have. I can tell you that on day 1 and 2, we immediately made changes to bus routes. We added frequencies. We did some adjustments last week. If you know the bus route situation, please get it to us directly to Pat Scrimger, and we've got buses and resources on standby to do changes right now with the social distancing requirement. So
Okay.
yes.
Thank you. And in terms of the points that were raised by the Accessibility Committee Chair, will you be able to get those suggestions in a timely fashion?
Yes, I believe we have most of those covered. I want Pat to follow up on some other suggestions that he had, and we will certainly implement them if we need to.
Okay, I appreciate the effort you've made on the equity lens, and hopefully that will continue. And I noticed actually it did say that accessibility was taken into consideration in the report, but I appreciate the extra effort and the extra suggestions that were made. One more thing, in terms of the the reduced service, one of the advantages of it was the fact that was the agreement with OC Transpo to reroute buses on Saturday and Sunday to allow for the NCC to close the SGEM Parkway. Can we see that continue for as long as those numbers are down?
I believe so, Pat. That's part of the plan, correct?
Yes, we'll follow the availability of that road, and we'll just move our buses where they need to be to allow that to continue to occur.
Thank you. I really appreciate it. I see that it's being very well used, and it's a real bonus to the community for getting out there and staying healthy. That's all. Thank you.
Thank you, Councillor Kavanagh. Next up is Commissioner Caricato, followed by Councillor Gower.
Thank you, Chair. This is a question I asked through you at the May 13th Council meeting. Not sure if a written response is coming, or if I should ask the question now.
John, would you like to address that?
Certainly. No, sorry, I don't know what the question is, but go ahead, Commissioner.
Okay, so I had two. You can disregard the second one because it's pretty much answered throughout this report. But it was regarding, other than loss of revenue and reduced ridership, what sort of issues, if any, have bus drivers observed or reported on since March 16th, when the rear door boarding and other safety measures were put in place?
I think the general things we've observed is the non-destination customers, where people were just riding the system because they had nowhere else to go, or were accessing the system for comfort. Very low volumes. The washroom issue that Councillor McKinney raised, and then just ongoing what next in terms of as the pandemic evolved and shifted, and then an influx of information from other jurisdictions about what people were doing and not doing. Generally speaking, and this is a credit to our staff and to the union leadership, we have been ahead of the curve in terms of, I use the rear door boarding as an example. First jurisdiction in North America to implement that. Everybody followed suit. And so, again, testament to our staff, great employees. We have not had work refusals. We've not had issues. The team has brought forward ideas. The mechanics brought forward ideas of things such as ventilation, AC. We had one operator that talked about the feasibility of blocking off or redirecting ducts for ventilation in the system, which is incorporated into our plan. So nothing earth-shattering. Consistency in terms of application of rules. Complaints, I can tell you we had some complaints about why our para-transpo vehicles parked doing nothing, and that's because they were strategically deployed waiting for ridership. Para took a very, very significant decrease. And so we'd get people saying, why is that para vehicle parked in the parking lot? And we'd explain they're just waiting for dispatch to give them a ride. So those are generally the observations and things that have risen.
Okay, great. I touched on this earlier with the first delegation, but are taxis still being used to supplement para, and how many, or what's the ratio these days?
Yes, they are. And Mr. Greer can answer how many taxis he's using right now. Mr. Greer.
Thank you. Hello, Chair. On average, we're running with 72 buses daily and using roughly 15 taxis. So if we equate that into trips, it'd be about 335 trips on a bus and 214 with a cab. So if we just looked at today, I'm just running some numbers on today, it was actually, you can see the ridership is starting to come up. Today we had 410 trips on a bus versus 132 trips on a taxi. So hopefully that data.
Okay, and what is being done to ensure that the taxi drivers are required to follow these same safety requirements?
So with the taxi cab, the operators, what they have confirmed with us through their, if you look on their websites and that, and they're advertising to their customers, they are cleaning the cabs after each ride. We are working closely with them on encouraging the use of masks and things. But as more and more information becomes available, we're working closely with our taxi partners to ensure that they're complying with everything that OC Transpo is doing.
Okay, so are they Are there spot checks or like auditing being done of these taxi drivers to make sure they're wearing a mask or a face shield?
We are monitoring closely, so we're working towards audits with our control room supervisors and that, and we're working through that. Right now we're working on just looking at the volume starting to increase as the customer trips are increasing. We're seeing more and more activity in that area.
Okay, thank you. For the customer service centers, why is the only one being reopened in Rideau Center eventually when the Rideau Center is safe to be open?
Thanks, John. Mr. Chair, the Rideau Center is by far the busiest of the three. It's also the one that is located centrally and is, excuse me a second. It's also centrally located to where a lot of people who need the services that it offers are either working or are living. So it's centrally located. Our limitation there is only that we can only open it when the Rideau Center is safe to open itself. And we'll be watching, and if we have a substantial need at the other locations, we will see what we need to do to open those as well.
Okay. The additional buses or the capacity that'll be made available by deferring some of the planned service enhancements that were budgeted for this year. I think that was slide 31. I went and looked up what those planned service enhancements were in the budget we approved. A lot of it's like IT stuff, if I'm correct. IT upgrades. None of that stuff is essential or required to be done now, that it can be pushed off?
Sorry, Commissioner, the service enhancements deals with extra bus routes and bus service. What we will do is we're going to work with all the councillors and the members of commission. If there's problem areas that we will adjust, because we do our quarterly adjustments. What we're saying is we don't need that expanded service right now in some areas. We've put in what we're already planning on in Q1, and we'll use that to get us through into the fall. But in terms of the other projects, you're talking about technology and so forth, those we're trying as best as possible to continue with all of those initiatives and projects. And as you heard Mr. Kanalakis say, we're doing a update on all the key corporate plans, project plans, and giving an update as to are there things that we're going to have to defer because we've been focusing on COVID.
Okay, my concern in asking the question is that any of the service enhancements to Paratranspo aren't reduced. Can you give us that guarantee today?
Absolutely. The Mr. Scrimger gave an update, for example, on the online booking and so forth. The last thing we want to do is defer any Paratranspo work. So that is rolling along and we're on schedule with that. We talk about it every week at our management meeting.
Great. That's important. Okay, so the other thing that kind of struck me about the report was in the risks and mitigating measures. And the one that really stood out to me was conversations that staff are having. I don't know if it's your staff or if it's the general manager's staff with, I guess, large employers and institutions to discourage them from, I guess, bringing their employees back to work or staggering the class hours or off-peak hours. So a few questions about that. Who are these conversations occurring with? And yeah, and who's leading them?
So at the corporate level, it's the city manager. He is dealing with Treasury Board as an example about the federal government to get a read on what their plans are. When will employees return to work? Is there an opportunity to stagger hours? What their flex time arrangements are? Will they be adding to that and so forth? The universities, same thing, generally in contact with our emergency control center, which the city manager chairs. But also we have relationships with the university, and it's pretty obvious. I mean, many of them have clearly stated they're going to online, and the trickle effect on that is if you look at Ottawa U as an example, there's a high peak demand for train service in the afternoon, not so much in the morning because it's staggered and so forth. And then we are just generally getting the message across in the report and other means to employers if they have ideas about what kind of return to work strategies they will look at. But remembering our key peak drivers of morning and afternoon rush hour is the federal government, universities, and some of those places. And then others have made statements such as Shopify is the end of the year. And then the city itself. I know Mr. Kanalakis was asked during the scrum, we're going to be coming back to council as part of the recovery plan. What is the return to work timeline for city employees? All those have an impact on what we'll do for volume. So those discussions are occurring at multiple levels.
If you can share, what's the response been so far?
Mr. Kanalakis is working with Treasury Board. I do not have that response yet. He's rolling that up as part of the recovery plan. Universities, we basically know what all of you know, that I believe all of the universities have said they're going to online. I'm not sure where Algonquin is, but I know Pat's reaching out to them. Same with La Cité. The other ones we've got to watch very carefully is the schools, the high schools that we provide the service to. We've assumed the fall service in for now, but again, it's a rolling plan, wave plan, so we can adapt and so forth on the fly if we need to. And then the rest, we know the Shopify one, and then the rest will all be the individual employees, which will follow parallel with the recovery strategies of the Economic Development Committee that you've heard from and so forth.
Yeah, just wondering if you at all or your team are concerned about overall a reduction in use in riders, not just during the pandemic, but for the next couple of years, and what effect that has on your plans.
Oh, we are very concerned about that. We all need to be concerned about that. I know Mr. Willing's watching this. He tweeted something out, I believe, on the weekend about that. And I can tell you that the panels that I'm on looks at recovery, attracting ridership, sustaining it. What will it look like post-COVID? But also, I believe it gives us an opportunity to reinvent transit and moving into space such as mobility as a service and interoperability with other modes and so forth. So there are some very, very complex discussions and future budget discussions that will need to occur in terms of where transit's going. And again, I'm an optimist. I believe there are great opportunities to expand transit and through reinvention. Things like the open payment, standardization of that in the industry helps people embrace transit and make it easier to ride, just as a small example.
Okay, and my last question is, since we're looking at ways, I guess, not to discourage people from riding the bus, but I guess staggering and sort of limiting peak times, I'm wondering if you, as the general manager of transportation, are working with councillors and city staff on other ways to help relieve pressure on our buses and trains, like making cycling infrastructure improvements, making walking easier, so that people who normally would take the bus could, with the nice weather, I guess, benefit from taking their bike to work. Cycling connectivity is something I hear a lot about between wards and improvements there. So I wonder if there's been an effort on your part to look at that as another way to, I guess, reduce the amount of people traveling on our buses during peak times.
Yes, we have a small example of that is the Rock and Roll program. We could have deferred that, but we insisted that it proceed. That requires resources, mechanics, and so forth, And so, absolutely, it's an integrated system, and yes, is the short answer.
Okay, yeah, I would like to see some of those ideas, if it's possible, I guess, in future presentations.
Okay, thank you, Commissioner Caracato. Councillor Gower, please.
Thank you, Mr. Chair. My question is about the fall service changes and the note that service will operate basically with the same route network that was in place in January of this year. And Mr. Manconi touched on it in a response to Commissioner Caracato. I just wanted to get some clarity on how you are approaching service additions to newer greenfield neighborhoods, how that would be affected by kind of this route freeze that you're proposing.
Excellent question. Pat is going to meet with each one of you and every member of council to talk about the fall And also, we need you to feed us any issues. Again, it's a revolving plan. Who knows what will return when? I always say, you know your community's better. And then the greenfield development stuff, that's still occurring. So the chair, when we were talking to him about the concept of this plan, he made it very clear that we need to keep the flexibility open to insert routes and adjustments. That will absolutely be part of the plan throughout the summer. And then Pat is going to be meeting with every member of council to say, you know, as we get closer to the fall, what do we need to do going into the winter season to do any adjustments and so forth. So we're maintaining some flexibility.
That's good. I'm glad we have the flexibility, and I'll follow up offline with Pat. Thank you.
Thank you, Councillor Gower. Next up is Vice Chair Cloutier, please.
Thank you very much, Chair. Sorry about that. Thanks for the presentation, Mr. Manconi, and Ottawa Public Health. Transit is certainly vital, and to the economic relaunch and our environmental goals. Vital service for our community, and public health is certainly experts in keeping our residents safe. So I sure do appreciate the partnership and how this plan was prepared. Mr. Manconi, do you have any, I understand that no other jurisdiction has instituted masks. Do you have any experience from other cities in terms of post-pandemic, or as the curve has flattened, the acceptance of the reacceptance of transit, the relaunch of transit, the confidence and the trust? Do you have any data from other jurisdictions in terms of when we might see our numbers go up, not only as a result of the phased economic relaunch, but just the acceptance of transit by our customers, the trust of it?
Too early in North America. We're watching those jurisdictions that have done that, and some of them are literally in the same week horizon as this one in terms of approvals. I think Washington was either last week or they're going this week. I want to watch Washington because their general manager had the exact same questions that you folks are asking me, and the whole enforcement piece was really the discussion there. New Jersey's had it for a while. Pat is getting a database of everybody that has implemented. And even on top of all that, UITP, which is the international forum for all this, I'm getting emails as we speak right now from them. They have great data on who's implemented masks worldwide. And what we're going to be asking them to provide is exactly the question you've asked. It's the acceptance level I'm looking for. So too early to tell. I know there have been other places in the Orient in particular where masks have been the norm for all functions. But that's a little bit different to compare it to us here. That was more based on air quality and so forth. So from a pandemic perspective, we're all sort of in the same boat. Spain made it mandatory, was one of the first ones. We're looking at getting some data from them, from our UITP partners.
Spain made it mandatory on their public transit systems for masks?
Correct.
So when you said that no other jurisdiction had, that was in North America? Is that
Canada? In Canada, nobody's done it. They're all highly recommending it. They're all asking me if we're approving. They want to know how it's going here. In the States, there are several agencies that have done mandatory requirements.
Just another question. You spoke of how we'll deal with it. LRT stations, they're sanitizing. There'll be red vest ambassadors there present. The flow is that a customer will be standing at a bus and want to board and may have forgotten their mask. How will we equip our bus drivers to message that to the customer? Or will the buses have a supply of masks in the first few weeks, recognizing that we expect customers to bring their own masks, to assist the customers within those first few weeks?
Yeah, no, that's a great question. The masks on buses presents a challenge. I don't want drivers mixing driving with masks and dialogue on that. They have a schedule to adhere to. I don't want their ergonomic environment. I don't want customers interacting in that space. We put up those shields for a reason. Buses will be a challenge. We're not going to be refusing people to board onto buses. I think once they get to transfer stations, if you do go to a transfer station, and that includes BRT, we're looking at bus rapid transit also. We all like to talk about the LRT, but we've got a very busy BRT system with a lot of good points where we can intercept some of those customers with our extra staff that will be out there with surplus masks, particularly in the early days.
Just one more comment, question. We don't want to, there will be a certain amount of other passengers interacting if a rider doesn't have their mask, and recognizing many medical conditions are invisible medical conditions. What resources are we giving the drivers, or how do we expect the drivers to deal with those situations if there's an interaction between two passengers with respect to one wearing a mask and the other not wearing a mask?
So all our operators get what's called de-escalation training right now on any situation, and one of the most obvious ones are fare disputes. Sometimes you have a customer doesn't want to pay, or altercations with other. That de-escalation training is going to have this lens applied to it. So we're going to talk about that, remembering that every operator has at the forefront safety being their number one priority. So if things get out of hand, they can always stop the bus. They press what's called the red line, which is a silent alarm, and they have resources immediately prioritized and dispatched to them on that. So we don't want them getting into disputes. There is a de-escalation process, and I can tell you that although we hear about the negative ones, there's thousands of them that occur every single day, and I know many of you met some of our operators that know how to defuse those situations, plus our public education campaign out to the public.
Thank you. And again, thank you very much for the presentation, for the comprehensive plan, for the partnership with the OPH. Those are all my questions and comments, Chair.
Thank you, Councillor Cloutier. Next up is Commissioner Olson.
Thank you, Mr. Chair, and thank you, Mr. Manconi, Mr. Scrimger. A few questions. How many OC Transpo employees have tested positive for COVID-19?
I'm going to ask, I know they're all back. I don't know if I have the number. Jim, would you have the number, Jim Greer?
I don't want to quote the number right offhand. I'm thinking it's in 6, John. So I think we're at 6 now.
It's under 10, Commissioner Olson.
How many have returned to work?
All of them.
Okay. And this is either for you or Dr. Maloney. How many cases of COVID-19 in the city have been traced back to OC Transpo buses, trains, or paratranspo vehicles outside of OC Transpo employees, of course?
Yeah, great question. I'm thinking that I'd like to get back to you on that. I can't think of any instances where there was documented transmission. But as I said, I'd prefer to get back to you with a response. The one thing I will add is, and I think it was Pat's team who asked me, saying, going forward, how will we know if there's been transmission? And I mean, I think it's certainly something that we're going to want to keep an eye on. I think if and when we have contact tracing apps, and sort of all levels of government are looking at those that people would have voluntarily on their smartphones, will aid us in that, but we're not there yet. The issue will be that people who are using transit are going lots of places. Probably they're going to work, they're going to stores, they're going to other places, so it'll be difficult to know exactly where they might have been exposed. But if we'll be looking for patterns of transmission, people using the same route, for example, that kind of thing, to be able to detect in the future. But I can have someone get back to you in terms of whether we were aware of any transmission that would have occurred in OC Transpo.
Thank you. Thank you.
Commissioner Olson, I just got the data. 6 operators is the number, and then there was 4 other staff, a total of 10.
Thank you. You referred to, or Mr. Scrimger referred to, the CUTA APTA risk reduction framework, and there's some elements of that I see that OC Transpo does not appear to have adopted in its plan. Just wondering if you could explain a few of them. One is eliminating overlapping shifts by employees. Also making people flow in stations one way where possible, and also prominently posting when the last cleaning was done on vehicles and stations.
So in terms of overlapping shifts, we've actually implemented that even prior to this plan. Mr. Greer did a phenomenal job with his mechanics as an example. We even added additional space for our drivers' lounges so they weren't crowding, spaced out cafeterias and so forth. So we did that piece. And the stations, there's a team right now going through every single station. Again, it's not just LRT, it's also BRT and also large platforms to see if we need to do any flow control, walking control, and so forth. The challenge with that one is I think it's easy days when the volume is light. If we get to big, heavy loads, it'll be a challenge, but we will do it. And sorry, the last one was, Commissioner? What was the third one?
Prominently posting when the last cleaning was done on vehicles and stations.
Yes, I believe so. That sticker that Pat showed in his presentation, that's it's a peel and stick sticker that every bus, as soon as it gets cleaned and rail car, it's on there, and then the operator knows that he or she, when they're receiving that vehicle, has been sanitized.
Okay. There's been talk of shifting work hours to reduce ridership in the peak hours. Certainly in some areas of the city that is possible. In other areas such as Canada South or the suburbs more generally, it's very difficult. For example, where I live, it's almost impossible to get out of the neighborhood here by bus outside of peak hours in the morning, and certainly get back to the area outside of peak hours in the afternoon. Has that been factored into any discussions about the reopening plan?
Pat, could you speak to that, please?
It has been to some extent. Our largest destinations are in the central area, and that's where the universities and the major office buildings are, and that's where the city manager is going with his contact with the Treasury Board and what others are doing with their discussion with the universities and colleges. For other areas, we have already boosted service to the non-central hospitals, and that will continue. And we will continue to work with, hear from customers, from employers, what their travel needs are. I'm going to say that places like Canada South aren't likely to show anytime soon that we are running out of capacity on the transit system for carrying people to their workplaces. But if their work hours shift, we will want to know about that so we can make arrangements to carry them to and from their work.
Okay, thank you. There was a UK study done in 2018, actually before all this, found that passengers faced a much lower rate of contracting the flu, or much lower risk of contracting the flu, when they didn't have to change buses or trains. And that is if they just got on one bus or one train, got to their destination and got off. That kind of speaks to what I know people have been raising since the LRT was put into place, and that is having the peak period buses, certainly from the suburbs, go straight from where they start to downtown, and avoiding the transfers for the West End, for example, at Tunney's and then at, say, Lion or Parliament or whatever. Is this something that was considered or could be considered?
I can't comment on the science or the medical evidence, but in terms of what you're proposing, to be candid, that would be about undoing the LRT, and no, we did not consider that. The flow control piece that we talked about at those transfer points, yes, but in terms of bypassing those transfer points, no, that's not something we're recommending.
And another question, seniors. We know that seniors are the most at risk in the population of having a severe or catastrophic outcome to COVID-19. Based on the plan, based on what you've told us, what is your advice to seniors? Are they good to ride the OC Transpo now? Should they be taking extra precautions?
If I could ask the Associate Medical Officer to comment on that.
Yeah, no, thank you for the question. You're quite right that the rates of severe illness increase dramatically with each decade. we still are in a situation where the province's chief medical officer has recommended people 70 and over to continue to self-isolate. We also tell basically all older adults to be sort of cautious in terms of avoiding crowds, to pick times when they go shopping, to be around less people. I think that it would make sense going forward to provide advice to seniors in terms of you know, all the things that they can do to protect themselves, but also be choosing times to travel on non-peak, and to depending on their health situation. I think it's going to end up being an individual decision in terms of their travel options.
Okay, thank you. Mr. Manconi or Mr. Scrimger, if an outbreak were traced to a bus route or a bus or a train, I take it you do have a plan or protocol in place to work with Ottawa Public Health from there. Is that something that you could share with us? Or
Yes,
do you have a...
Absolutely. We have a plan. I'll do a quick overview, and if you need more details, I'm happy to provide that to you. We have a Transportation Services Department COVID task force that was struck, I think, a couple days into the pandemic. That is our immediate response team. The minute we hear of someone that has or potentially has COVID, they do immediate tracing with public health. So public health does the tracing with us, and then we take it a step further. We do the tracing throughout the entire organization, and it is 24/7. We don't wait for the next day. And it's literally within hours. We know every single bus route, a touch point, and so forth. So you've seen my memos that I've issued. That's how we get that data so quickly, with the great guidance that Brent and his team has given us, and the support from a public, and then also the internally, right down to the lunchrooms, the mechanics areas, the washrooms that individual may or may not have used, and then there's follow-up directly with the employee.
Okay, thank you. Last question, maybe a series of questions on masks, and I'm certainly all in favor of the idea of masks. I wonder about the mandatory nature of them. What I'm curious about, first question is, what led OC Transpo or Ottawa Public Health, what information, evidence led either OC Transpo or Ottawa Public Health to conclude that a voluntary approach to masks was not going to be sufficient, and that mandatory use was necessary?
So I'll go first, then I'll ask the Associate Medical Health Officer to comment. So the guidelines, the requirements, even from the provincial ministry, is crystal clear. Enable social distancing, and when you cannot, you have to introduce other measures. We are seeing an increase in our ridership. Council has a recovery plan that they want to see the city recover from this pandemic. Ridership will increase. We're already hearing comments about that. And if I cannot social distance, and because we know the ridership level is increasing, we had to go to other means, and we used all of the science and the information that's out there to go with the masks. And to be very, very candid with you, without the mandatory mask, we don't have a solution for you other than to say transit system will slow down. We will limit people on the number of people that can board, and the recovery will be much, much slower. So we'd have to redo everything, and unless there's other ideas that people have out there, but we cannot provide the social distancing, which we are required to do from public health at the provincial and the local level. And I'll ask the Associate Medical Health Officer to comment.
Great, thanks. Thanks, John. Thanks for the question. You know, I think that when I first was looking at the draft plan, and I was sort of, you know, my mind was still like what we have, you know, now, where we have, you know, a fair bit of distancing that's feasible on the vehicles. And when I read through the plan in terms of what the projections are that were walked through in the plan and in the slide deck this morning, that you know, fairly low thresholds of ridership will mean the inability to maintain distancing, which sent a, you know, a flag up for me in terms of how will we make this service as safe as possible. And as been, described earlier, like this isn't a discretionary choice for people. This is a service that's foundational for a city. It's how people get to work. It's how people access services. It's how people get to school. And so really, when we lose distancing, which is our primary means of defense against this virus, which is still going to be around with us, and we have to learn to live with it going forward. What are the other approaches or strategies that we can use, and it's in the campaign in terms of telling people, if you're sick, please don't use transit. Please wash your hands, clean them before and after. I would also add respiratory etiquette. What do you do with sneezes and coughs? But then masks become critical and need to be as universal as feasible, recognizing there's some who can't wear them, but for everyone else, we need to maximize mask use.
Okay, this question is also for you, Dr. Maloney. The Pan-Canadian Public Health Network, which is chaired by Theresa Tam, of course, and many, federal, provincial, and territorial officials are on it. On May 20th, they recommended non-medical masks be used in areas like public transportation, quote, when the local epidemiology and rate of community transmission warrant it. So apparently Montreal and Toronto officials don't believe that their local epidemiology or rate of community transmission warrant mandatory masks. What is it about Ottawa's epidemiology for COVID-19 and the rate of community transmission, which is far lower than in those other two cities? What is it about the epidemiology and community transmission here that make masks mandatory?
1 minute.
Should make masks mandatory.
Yeah, no, thanks for that question. I think we've been successful in Ottawa where the public has really acted collectively with respect to the physical distancing piece to be able to get us to a point where we can reopen. As I said earlier, we're going to be in a really challenging balancing act over the foreseeable future to not have a resurgence that would require the reinstitution of restrictions. The modeling that exists indicates that if we have basically a 20% reduction in our control efforts, that there is a good probability of a resurgence where this virus begins doubling every 3 days again, i.e. growing exponentially by August or September. I was actually just in parallel looking at a study from high schools in another country where they relaxed their physical distancing, mask use, and hand hygiene, and now are dealing with outbreaks in high schools. I mean, this virus will take advantage of opportunities that we present it to. So if we want to run a transit system where large numbers of people are coming into contact with each other that cannot maintain physical distancing, we need to do all that we can to prevent transmission. And that's, I think, before we have the virus back in exponential mode where it's doubling every period of days. So we are fortunate that we are on that tail coming out of our first wave. We're trying to prevent a second wave, and we're trying to reopen while there's still virus present. I would point out that when you see the number of cases that are reported, they reflect what's been happening 2 or 3 weeks ago. So the case counts sort of are backward looking. For every reported case, based on the literature, there are probably somewhere between 5 and 25 undetected cases out there. And so we want to open cautiously, and we want to be able to have businesses restart. We need transit to restart, and so we need all of the protective interventions that we can to be successful here.
Okay, Mr. Clerk, do I have any time left, or do I need to put myself back on the list?
You have roughly 50 seconds left.
Okay. I want to say that I'm worried about making masks mandatory. I'm worried from the perspective that a lot of disabilities can be invisible, and not just that someone might be deaf, but there may be mental disabilities that also make it so that someone cannot wear a mask. I worry that people like that may be subjected to harassment or intimidation, or worse, even violence on the bus if they're not wearing a mask. Also, they could be almost forced to divulge their disability to strangers. I don't think anybody should be put in a position like that. I'm all in favor of masks, but I think they should be voluntary, not mandatory. Mr. Maloney, I want to congratulate Ottawa Public Health. I've looked at many websites on COVID-19 for the different regional health networks in Ontario. Your guys' information is probably the best. You're probably the best in the entire province. So my congratulations. Thank you.
Thank you very much for that. We work hard at it. Thank you.
Thank you, Commissioner Olson. Okay, we're now, we have one councillor that's not a member, and we have two commissioners that want to go back on the list. Is there any commissioners that haven't spoken yet that want to ask questions? If you can hit your hand button, we'll get you on there. Commissioner Williams had emailed in some questions this weekend. Did they get answered for you, Commissioner? Is Commissioner Williams with us, or?
Mr. Chair, I think Commissioner Williams had to leave due to work commitments.
Okay, thank you. Okay, we'll follow up with her then by email to see if she got her answers. I just have one question then before we'll go to Councillor Menard after this. For public health, there's been some mention about masks, mainly cloth masks that people are making in the community. I know in my own community, there's a retired seamstress, I believe, that has a basket on her lawn where she just makes masks and put it in the basket for her neighbors to pick up and stuff. There's others that sell them just for a nominal cost to cover materials. Is public health good with these? Like I'll say I've seen some where they use coffee filters within the mask as an additional layer of protection and a disposable layer. I just want to get your comments on that. Is that something we should encourage people to consider, or should it only be store-bought?
Yeah, no, thank you for that. I mean, it's amazing how much has changed in a period in weeks or months, right? And I think we're at a point where we have a supply issue with masks, and we continue to learn about what works. On our website, we have some good guidance in terms of the features that one should look for in masks. So, and I think that goes for whether you're making them yourself, whether a friend's doing it, or even if you're buying it, because just because you're purchasing it doesn't necessarily mean the desired characteristics are present. So, for example, I know one institution that bought a supply of masks, best intent, and they came with one layer, one ply. And, unfortunately, in talking to them, sort of pointed out that, listen, the best advice is that there should be 2 layers minimum. Ideally is there's issues around thread counts, there's issues around fit. That it should be snug. I mean, when I wear mine, when I go out shopping, you should feel that you're putting air through the mask, because if it's just going around, then it's not doing its job. Different people have different shapes of their faces, and so the masks that have horizontal pleats fit a much better range of different sizes and shapes of faces. So as I said, we've put a bunch of this information on our website in terms of what to look for. I wouldn't be concerned, frankly, with it, if it's a local seamstress making it, that would be any more of concern than purchasing one, frankly. I think it's sort of buyer be aware of what you're looking for and what features you want to have in a mask, and to have that, whether one's having one spouse make it, family member, local seamstress, or purchasing one commercially. As I said, our website has a bunch of information to help out with those choices.
That's great. Thank you. One last question, and you may want to touch on this as well as Mr. Manconi. I sense a hesitancy, and certainly the emails I've received since the report came out on Thursday, the only concern highlighted with all the recommendations in the report is what's been discussed here today, which is the mandatory portion of the mask piece. Maybe we should look at the reverse of that, and if we do not go with mandatory, could you please touch on what that would look like if we didn't do mandatory, and between the two of you, maybe you could draw a picture of the risks of not bringing this in?
Maybe I'll start. From the public health perspective, our goal is to have as little disease and as little transmission as possible so that people don't get sick. So from a transit perspective, from a mask perspective, we want to see as many people as possible who can wear a mask do so. That at the end of the day, that's what we want achieved. And we really look to, the operator or an owner of a business, if we're talking about something else, as to what do they think in terms of running a business and running, in this case, the operations of a major transit system in order to achieve that goal of maximizing mask use.
John, did you want to add anything to that?
Thank you, Chair. And I'll apply the service lens to that. If you went with not it being mandatory, I think we're introducing a bunch of risk, and we clearly have guidelines from the province and from public health that says you have to do social distancing on your system, and when you cannot, you have to go to other means. We would then revert back. My recommendation to you would be, if you're not going with mandatory, manage the service accordingly. So Pat, roughly on a 40-foot bus, how many people can you put on if you're doing social distancing? What's the number?
If the front of the bus remains closed, we're around the 8 or 10. If we can open the front of the bus as we're doing, we can get to 12 to 15, depending on the actual individual model of the bus.
So we would take that number, we'd put all that back into the recovery plans, and our advice to the city manager and others working on that is slow down, because you will not be able to handle the increase that you're about to see. And so it would have a downstream effect. Otherwise, I would not be able to protect people as per the guidelines that are out there, which are clear. Social distance, so blank out the seats, reduce all that stuff, or go to other engineering means, other protective means.
Okay, thank you both. I appreciate that. I hope all commissioners consider that when it comes time to vote on this motion. So now, Councilor Menard, please.
Thanks very much, Chair. Just a couple of quick questions. Thanks to staff for laying out the timeline for this summer and the fall and the restart and the comprehensive presentation. That was great to see. Just as a theoretical, if someone is not wearing a mask, so if I'm not wearing a mask and I'm going to get on the bus, and it's after the first couple of days when we say we'll have extra masks for people, are they going to be refused entry to the bus, or what is the protocol at that point?
The messaging is to our bus operators, they are not going to be refusing anybody entering into our system. We have all those measures that we've talked about in terms of communications, the extra masks. If they get to a BRT or an LRT transfer station or a large transfer station, They will see ambassadors and supervisory staff who will have a few extra spare masks with them and so forth. So we are not refusing anyone. And then that's coupled with the training that somebody may have an invisible disability that you don't know about, and we're going to take people at their word. Again, we're going to, it's like the grocery stores. I'm amazed, very much like Brent has said all along, is as a community, we've all come together. I go to the grocery stores, and yes, there's the odd little dispute, but people are very orderly. They're very respectful. They're following the rules. You will always have one that gets challenging. Like I have one right now. I have a resident customer that calls me every single day that says I should ban cell phones on buses. He doesn't want people to use their cell phones. So we'll always have one of those, but a very respectful messaging campaign, good education. My dream is that this group, this board, this commission supports it unanimously, because that will really resonate with the community, that you're behind it and so forth. So it's that well-balanced tone that we've all talked about.
Okay, I appreciate that, Mr. Manconi. My concern is around the timeline that we're providing masks if needed. I know we're bringing in 200,000, and that's not to start until, is it June 15th, mid-June, when we're trying to implement this. So I'm wondering if we can extend that for a longer period of time. I mean, I guess it depends on take up of the 200,000, but is there a way we can evaluate how this is going within the first few days, first week, and then see if there's a need for more? Obviously, if we're talking about the safety of the public and the nominal cost associated with these masks, that may be in order. Is that a possibility?
I think it is. If I could take that as general direction, and the reason I'm hesitant to say a definite yes, I like the concept, that we adapt, and if we need to add, another 50,000 or so forth. I'm just trying to be very respectful of they're non-surgical masks, but there is a supply-demand issue, and there's a queue in terms of the logistics support that our emergency management team, Pierre Poirier and Tony DeMonte, are doing. So I don't want to say yes without me knowing that I can execute that. We put in that order. We were very proactive. We put that in the queue, I think it was a couple of weeks ago, to get it going. I would have to take that as general direction to see if we want to adapt a little bit of that. If we see that the 200,000 masks disappear on day one, well, we obviously have a bigger problem that the education campaign hasn't worked. I'm just very concerned about people thinking that those are reusable masks that are there being provided to them. And that is the constructive criticism I have to other agencies. Other agencies have provided these disposable masks, but you'll be in it forever, and you will not get the cultural transformation that you're looking for in terms of masks are needed right now for everyone to help each other. So, and I'm worried about people reusing them and so forth. So generally I understand the ask, if I could take that away as a potential tweak that we would do on the fly, if it's feasible and so forth, but with those other caveats in terms of concerns about people then reusing those masks thinking they're reusable. They're not.
Okay, very much appreciate that. And then just my last point on this is there's been concerns expressed to me around, and Councillor McKenney raised this as well, but I just want to see how we're going to be doing the monitoring. Concern around assaults, sexual harassment, hate crimes, or discrimination that's been witnessed previously, that could get worse as a result of anonymity. And there's a concern, obviously, that's also been raised around disabilities. And so how are you going to monitor it? What is the mechanism to monitor it? How are you going to get feedback and potentially change if we are seeing those incidents increase because of anonymity?
So we've stepped up the presence, which I was explaining to Councillor McKenney. We'll continue with that presence. A reminder that we've got a very extensive camera network. We have not seen an increase in any of that yet, but I understand the point, around anonymity, that people may take this as an advantage. The presence will be very, very significant. We will, for example, be rolling out all the ambassadors as part of the rollout. We've even received criticism on that. Why are they there? There's no volume. It's for exactly what you and Councillor McKenney were talking about. Presence in a transit system, particularly when ridership is low, is important. So we'll roll out all those ambassadors. They're being trained on everything we've talked about also. And then we also have our special constable units and extra patrols. Our bike and roll is rolling out. The walk and ride is rolling out. So all that will be part of the plan, and we'll certainly monitor it.
Thank you very much for that. Thanks, Chair.
Thank you, Councilor Menard. Next up, Councilor Kavanaugh, please.
Thank you very much. I wanted to ask about employees. If they're known to be exposed to the virus, are they eligible for paid leave until after that, for the 2 weeks, to ensure that we do not have somebody who's in that period that could pass on the virus?
So we have a very detailed process corporately that was rolled out early on in terms of making sure that they're fit to return back to work. And that's part of both the tracing and the return to work process. So you're monitored throughout, and then you come back and you do that testing, the self-test, to ensure that you go back. Brent, did you want to comment on that?
Well, I mean, certainly, I mean, it's going to be your corporate policy in terms of paid sick leave, that sort of thing. But certainly, anyone who is a confirmed case needs to stay in self-isolation for 14 days and to be improving and be symptom free for 24 hours before they can return to work. And if they meet those criteria, then they're fine to continue to work at that point.
That wasn't the question, though. I was talking about being exposed to the virus. For example, they're known to be exposed to the virus.
Oh, sorry.
In my case, if I'm exposed to the virus, I can self-isolate at home and continue working. But obviously, a bus operator can't do that. So how does that work? How does that?
Right. So I can do the public health answer first, but then it's going to be the corporate policy for people who can't work. So I mean, if it's a close contact, then that person would, as you indicate, be required to be in self-isolation for 14 days. Which is the incubation period for the disease. If it's not quite a close contact and we put it in a medium risk category, then they would need to self-monitor. They could continue to work, but they would self-monitor for 14 days. But Councillor, if your specific question in terms of what happens if they have to be at home for 14 days, I would turn that back to John to address as to how the OC Transport would deal with that.
Sorry, Councillor, I misunderstood the question. Yes, if you're sick, you're sick. If you're off because you believe you've been exposed, you get covered under sick leave and they are paid.
Okay, thank you. That's very helpful. Earlier on in the year, there was a motion passed that I put forward about IT upgrades on locating buses and on when they're going to arrive. And we were, you were very positive about it, that could happen. With the reduced service, that would come in handy right now. Where is that at?
Pat, could you comment, please?
Sorry, I'm just coming back here. All of that work continues as before. All the work that's outlined in the business plan is continuing to happen. The work to transform the way we deliver on time, the real-time information to the various app vendors is coming. The only thing that's holding it up right now is that we have to identify a time when we can put a task team on implementing that new software that isn't interfering with our work to administer our response to COVID-19. So that new software is ready to hit an implementation time, but it right now wouldn't be the right time to do it. But we certainly expect to find that time over the next few months and get it implemented.
Okay, that would be great. So I look forward to that, especially with the reduced service. In terms of being mandatory on the buses, what about in bus stops, in transit stops? Is that required as well? Does it extend there?
Yes, the way we've written it, it's all parts of the system.
Okay.
Absolutely.
Okay. Thank you. And in terms of fares, are we going to continue to freeze the fare for a while during these trying times?
Yes, so the fare freeze is caught up in the when LRT gets back up to normal status, and so we have updates coming to you on that in terms of where we are with the rectification plan. So the fares will stay where they are for now.
Thank you. In terms of the Presto card, is it possible to help those with the low income to make the card available free so that they would be encouraged not to use cash as much?
If there's any waiving of fees, I'd have to check with clerk's department. We'd have to get you a motion to draft up to give direction to staff and get the funding source on that. So if you want us to take that away for consideration, I'd have to consult with clerks and I'd have to cost it out. I don't know what kind of an impact it is, Councillor, off the top.
Okay, but it's related to the COVID-19 in terms of making it so that they don't have to, there's no touch. Okay, thank you.
Thank you, Councillor Kavanaugh. So Commissioner Sarah Wright Gilbert, please.
Thank you, Mr. Chair. I just have a couple of follow-up questions. So obviously there are some folks who are exempt from wearing masks because they have breathing difficulties such as asthma. Is there a way that we can make it a little easier for them to self-identify that they are not required to wear a mask? Something like a card to identify them, much like our priority seating card. Is that something that we can offer our customers so that they don't have to sort of go through the rigmarole of maybe revealing their medical condition or anything like that? Is that something we could do?
I think we're open to all suggestions, but we have to be careful because there's a stigma to doing that, right? And some people truly don't want to do that. We have a lot of good experienced staff that know how to work with these groups. We'll consult with them, Commissioner, to see if there's things they want to do. I think where they'll go is no, they don't want a tag on them. I wouldn't want one, but we'll consult with our advisory groups and the accessibility group and so forth, and see if there's something they want us to consider.
I appreciate that. And I appreciate that there is a stigma in terms of self-identifying. I want to make sure we keep all of our customers safe. And if they aren't required to wear a mask because of breathing difficulties or whatnot, then I want to make sure that they're not being unfairly judged by other riders, perhaps. So on just talking about something we haven't talked about a whole lot during this meeting, which is the ongoing and monthly costs of the health and safety measures. So on page 16 of the report, it actually says that there's an initial startup cost of $325,000, a monthly ongoing cost of $950,000, and those amounts are being funded using existing funds in the budget. Where specifically are these funds coming from?
So right now, everything's being charged and tracked through our operating budget. Our treasurer does the monthly updates to council when she does her COVID updates. And I know that Mr. Kanalakis and the treasurer will be giving a wholesome update. I believe it's at the June 10th report on where we are financially. The costs are racking up, and there's also the lack of revenue. I think we lose about $3.5 million a week in revenue. So it is significant costs, but to do things right, we're going to have to spend some money. The treasurer and I speak almost on a daily basis with this. She's been integral to this plan, as her staff been.
I agree with you on to do things right. We have to spend some money. I have no issues with the money spent. I was just sort of wondering where the money was coming from. The monthly cost of $950,000. Can you provide just sort of high level, we don't need to get into the weeds, detail in terms of what's included in that amount?
Certainly. And just on the funding, there was one other point. You recall the mayor wrote to the FCM, to the federal government, to look for funding. Every transit agency across Canada, including CUDA, which I'm a member of, is asking the federal government to fund transit agencies from a revenue loss, from a sustainability perspective and recovery phase and so forth. So that's one area that we're looking at as a potential revenue offset. In terms of the costs, you have the barriers, the operator cabs. That's all, a fleet of 800-900 buses that need to be done. There's also the masks. There's also the promotional material. the communication piece. Those are some of the big costs. Some additional staff, hundreds of additional cleaning resources. We've brought in external cleaners. We have the rapid response teams that use smogging equipment and so forth within the decontaminated bus. Extra cost to RTG for cleaning all of the stations and the LRT train station. That is a change order. They will be paid for that extra cost and for our extra resources, overtime and so forth to get cleaning done.
Okay, so included in that is not, in the $950,000 is not overtime for drivers, for example, for being on standby with those additional buses if we needed?
Well, because of our staffing plan, which was very effective, we've actually reduced overtime for operators. It's one of the offsets that's helping us. It's on the expense side. That's a bit of an offset right now.
That's great. That's amazing. So we're hearing that universities are, for the most part, are going to go online in the fall. We don't know about Algonquin, but U Ottawa and Carleton. How are we going to deal with U passes in that case? Will students still be required to pay for U passes that they likely won't be using?
We're having discussions right now with the university. Pat, I don't believe you've got the latest, right? We're not ready for an update?
Not yet. We've, our deepest discussion with the universities and colleges was for the summer, where they each briefed us on their plans. We're starting to hear from them on their fall plans, but I think they are still going through their governing bodies before they can get approval to make that information more widely known.
I appreciate that. Is that something that perhaps at a subsequent meeting we could hear back on?
Absolutely.
That's great. The only two things I'm going to mention before I finish, Mr. Chair, is that in addition to Ottawa Public Health's amazing website when it comes to COVID information, if folks are looking for information on how to put on a mask, remove and clean it, there are instructions on how to make a mask either using sewing or no sewing. I'll put in a plug for my employer. Health Canada has a really great COVID-19 website. And so you can find that there. And my that the tone and the approach to this report has been is very obvious that it's very collaborative and open, and I want to congratulate you on that. I'm very impressed with the approach to all of this, and I wanted to thank you for that. Thank you, Mr. Chair.
Thank you, Commissioner. Commissioner Caracato, please.
Maybe I missed it, but did Mr. Manconi address the question from one of the written public delegations regarding the March, I guess, fees or fares that were paid monthly?
So the question, if I recollect, is they're asking, can we issue refunds on the March piece? The answer is no. We did not suspend service. We kept service going. I know there's a bit of a myth out there that we suspended fare collection like other jurisdictions did. We did not do that. If you were entering the back of a double-decker bus or an articulated bus, you were still required to tap. On the shorter buses, the 40-foot buses, you couldn't tap. So that's one area that I know we're losing some revenue. But service ran. We did not take away service, and fare collection was still on. I know that's not a popular response, but unlike other programs, again, I talked to the treasurer and the city manager, where programs were canceled outright and you didn't receive the service, they were entitled to a refund. But no, our policy is clear. We had the service. I checked with the treasurer. We are not issuing refunds for March.
Okay, fine with me. Just wanted to make sure that was on the record.
Thank you, Commissioner. And so I have a question as well, Mr. Manconi. We heard a lot of discussion around the impacts of asking someone if they can't wear a mask to somehow identify that it's for a disability or some other means. There was some discussion of like a card or something to identify such a situation. It puts me in mind of the parking passes. If you have disability, you're issued a special pass that goes in your window, and that allows you special parking at any facility. And I've never heard anybody with a disability complain about that. So I'm wondering if, because all I heard today was other people saying that they think that this is going to happen. I wonder if between now and June 15th, we can put an extra effort into reaching out to the groups that represent folks that may have disabilities that would be impacted by this. And if we could get firsthand confirmation about their thoughts on this, like would they want to wear or take a card, or maybe they have a shield that they're wearing, because let's face it, we're not just asking someone to wear a mask to get on the bus. Wherever they're going on that bus, they probably need a mask or some sort of protection as well. If they're going shopping, going to work, whatever, there's going to be a requirement for some sort of protection. So my personal thoughts are, if I couldn't wear a mask for breathing disabilities, for example, I would probably want to wear a shield just so that I'm protected while I'm in that crowd. Because as you and public health have both mentioned, we cannot guarantee the physical distancing as the bus fills. So could I ask you to undertake that so that we could, before this rises to council, perhaps, sorry, I should correct that, it doesn't rise to council, but maybe an update at our commission meeting in the middle of the month, if you could let us know what feedback you receive on that, please.
Yeah, yes, Chair. We'll look at all those things. We'll consult with the various groups, and I could even, if it works for everyone, I think because it is a rolling plan, I won't be waiting for commission meetings. I'll send updates via memo on any significant changes or things that we've implemented. There's been many suggestions here today. We're tracking every one of them, and we'll just keep feeding the commission and council on any updates.
Perfect. That's even better. Thank you. Okay, so commission members, it's been a great debate. I want to thank all the delegations that came in today as well. Is there any motions or any final comments before we vote on the item? Commissioner Olson. Commissioner Olson, you're still on mute, I think.
Commissioner Olson.
I'm sorry. Thank you, Mr. Chairman. As I mentioned in the discussion, I'm not in favor of mandatory masks. However, what I wonder about, does that mean that I have to vote against? I don't want to vote against the entire plan, but mandatory masks are part of the plan. So if I support the plan, am I supporting mandatory masks? So that's my question. It's more procedural, I guess, than anything.
I believe the recommendation is broken into two parts. The concern, sorry, I'm just looking for the actual page. There we go. So there is two parts. So if it's the will of the commission, I guess we could break that into two parts for voting as well. I'm going to caution everybody. You've heard from both public health and from an operational perspective what it means if we do not bring in a mandatory mask. It can have very significant impacts not only on the health of our riders and our employees, but also on the operations. So if you want, we'll split it in two. I just urge you to think about that, okay?
Chair, if I may, it's John Manconi. I don't want to challenge at all in any way, or clerks could jump in, but I just operationally, it's the sum of the parts, and I think you're going to put us in a very difficult situation if I don't know where the vote is going, but if you approve the plan, but then the mask is a critical element of the plan, and we were doing this to ensure that there was clarity on what you were approving, and even the bylaw has the authority for me to do it. So I'm just stating a preference. I'm being very, very cautious here. I'm not telling you how to split it, but it goes together is my point.
Okay, then I stand corrected. Thank you, Mr. Manconi. We won't split it. It'll be one vote for the report as it's presented. Okay.
Mr. Chair. Mr. Chair, it's Councillor Brockington. I would request that we split the motion and commissioners can take under advisement the advice that the general manager has just provided us. But I'm uncomfortable with some components of one of this motion, but not the other. And I was going to ask for them to be split. Ultimately, I'm going to vote in favor, but I truly believe that people have heard the rationale and the merits of why this recommendation is before us. But I do believe you should allow a vote to go ahead on each item separately.
Which, Councillor Brockington, that's what I was looking at. But as you just heard, the advice from the general manager is it's a complete package. He, I'm assuming, cannot deliver everything else in the report if he doesn't have the mask component. So we'll leave it together. If you're not comfortable with it, by all means, you'll vote against it, and staff will have to, if the report fails, the staff will have to go away and rework another plan for us. Okay? So I think we should heed the advice.
I have the right to ask for this vote to be split, and that's what I'm requesting.
Okay, and as the chair, I'm denying the request based on the information from staff. So we're going to vote on the report as a whole. Okay, is there any other questions from anybody? Or shall we move to the vote? Okay, so the report recommendations is in front of us on the screen. If we could do the vote, Chris, could you do the roll call vote?
I can. Commissioner Brockington,
Yes.
Commissioner Caricato,
Yes.
Commissioner Gower,
Yes.
Commissioner Kavanaugh,
Yes.
Commissioner McKinney,
Yes.
Commissioner Olson,
No.
Commissioner Suds,
Yes.
Commissioner Tierney,
Yes.
Commissioner Williams, here, Commissioner Wright Gilbert,
Yes.
Vice Chair Cloutier,
Yes.
and Chair Hubley.
Yes.
10 yeas, 1 nay.
Okay, thank you. Thank you, everybody. Okay, there's no in-camera items, and I believe we have one notice of motion. At least I have one in front of me here. Commissioner Caricato, would you like to read the therefore be it resolved of your motion and introduce it?
Sure. So this is a motion I've been working on with Councillor Suds. I brought this up, I guess, back in November, kind of got the ball rolling. It's regarding advertising at stations and on trains. So we can discuss the motion, I understand, in 2 weeks when we next meet. And I'm happy to take any questions you guys have in the interim by email or phone. And so I'll just read, therefore be it resolved that the Transit Commission direct the General Manager of Transportation Services to commence a procurement process consistent with the city's procurement policy to identify potential revenue opportunities from advertising in stations and inside train cars on O Train Line 1, and that staff report the findings to the Transit Commission at the conclusion of the process, expected to be in Q4 2020.
Okay, thank you. And do you want to move to have that considered now? We'll need 3/4 of the vote.
I guess.
Now, or notice a motion?
I guess if there's interest among commissioners to proceed now, I mean, saves us a couple weeks, gives staff more time to start working on this. But if people want to reflect and discuss it among yourselves and talk to me about it, I guess I'm happy with that as well.
Okay, so let's ask the commission if members are willing to waive the rules to vote on this motion now. Is everybody okay with that? If not, raise your hand and we'll go from there.
I'd like to deal with it next week or next meeting.
Pardon me, Councillor Brockman?
I just want to read it and deal with it at our next meeting.
Yeah, I feel the same way, Chair. It's not that I don't want to vote against waiving the rules, but I think that having the time to consider it for 2 weeks is, or for a few weeks, is a good idea.
Same here.
Okay, thank you. Then I think Commissioner Caricato will hold on to this and we'll deal with it at the transit meeting later this month. Okay.
Yeah, happy with that decision. And if anybody wants to talk to me about it in the meantime, feel free to reach out by phone, email, or Zoom.
Okay. Yeah, thank you to you and Councillor Sudds for working on that motion. And so now moving on, is there any inquiries that anybody wants to submit?
I have one.
Okay, go ahead.
The Transit Commission has not met since February of 2020. Following royal assent of provincial legislation allowing municipalities to meet virtually, was the chair restricted in calling a meeting of the commission in April or May of 2020? And did Ottawa Council pass any motions restricting the chair from calling a meeting of the commission in April or May of 2020? Thank you.
Okay, anybody else? All right, a motion to adjourn. Anybody want to move adjournment? Okay, Michael, Commissioner Olson will. Wednesday, 17th of June will be our next meeting at this point. Okay, thank you all. Great to see you again.
Thank you, Mr. Chair.
Thank you.
Thank you.
Thanks, Alan.